was here a minute ago. She's there. She is. Are you all set, Anna?
Sure.
Okay. So good morning, everyone, and welcome to this morning's session of the Joint Standing Committee on Health and Human Services. We'll be in a work session for five different bills today, and we'll be considering them in the order they were published until Justice Mills shows up, and then we're going to jump to 1968 because she has a very limited window during which she can appear. So we want to respect that. We'll start with 372 and then go to 1574, and then we'll play it within, we'll talk about it after that. So if you're just joining us to watch the committee's work, you can all see us on YouTube. Everything that we do is recorded and viewable later on if you would like. Because it's a work session, we don't normally have people provide typical testimony, but the committee has the responsibility to ask of others information that might be helpful as we do our work. We have daily occurrences of technical glitches, so please bear with us and don't feel badly if you're a source of one of today's glitches. I will remind folks that as they are called into, or are they transferred from the attendee status to participant status, you go through a wormhole. You have to accept the invitation if you want it. And it feels like you're disconnected, but you're not. You'll get there. So let's start with introductions of the committee, and I'll begin with Representative Lemelin.
Morning, everyone. My name is Michael Lemelin. I represent House District 88, Chelsea, Jefferson, Whitefield, and half of Noblesboro.
Senator Baldacci.
Good morning. I'm Joe Baldacci. I represent Senate District 9, which is the city of Bangor and the town of Herman. Good morning.
Good morning. Representative Perry.
Good morning. I'm Ann Perry. I represent House District 140, which includes the communities of Indian Township, Baileyville, Bering, Calais, Charlotte, Robinson, Perry, Pembroke, and Pleasant Point.
Representative Griffin.
Good morning. My name is Abigail Griffin. I represent House District 102, which is Glenburn, Levitt, and Cadesque.
And Representative Madigan.
Good morning. I'm Colleen Madigan. I represent House District 110, which is part of Waterville and part of Oakland.
Representative Craven.
Thank you, Mr. Chair. Good morning. I'm Margaret Craven, and I represent House District 59, which is part of Lewiston.
Representative Stover.
Good morning. My name is Holly Stover. I represent House District 89, including the towns of Boothbay, Boothbay Harbor, Southport, Edgecombe, Westport Island, and South Bristol.
And as I recognize Representative Javner, one of these days we're going to have to hear about all of your towns that you represent. That's something that has to happen at least once a session. Maybe not today.
Yes, good morning. I am Kathy Javner, and I represent House District 141, which is located in Penobscot in Washington County.
Senator Moore.
You definitely don't want me to list my towns.
No.
I'm Marianne Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan in Hancock County as well.
Thank you. Representative Meyer.
Thank you, Mr. Chair. I'm Representative Michelle Meyer, serving Southern Maine's House District 2, which is all of Elliott, where I live, and parts of Kittery and South Berwick.
And I'm Ned Claxton, honored to serve the folks in Senate District 20, which includes Auburn, where I live, mine at Mechanic Falls, Poland, and New Gloucester. Our staff today who has kept the train on the tracks, I'll start with Anna Broom.
Hi, I'm Anna Broom. I am one of the legislative analysts for this committee. I'm not sure I'm keeping anything on the tracks at the moment. I work in the Nonpartisan Office of Policy and Legal Analysis.
Thank you. And Karen Thomas.
My name's Karen Thomas. I'm happy to be the clerk for the Health and Human Services Committee. Should you need any assistance, please don't hesitate to email me at hhs@legislature.maine.gov.
Thank you all for being here. So as we begin, let's start with consideration of LD 372. and start there. Many of the bills that we'll be considering today have amendments. So I will turn it over to Anna for 372, and we will bring in Senator Carney so that she can be part of this conversation. Did you want to start, Anna? Did you just want to start, Anna?
I don't really need to. I think you
Okay.
probably just want to hear straight from Senator Carney. I also just want to remind you, you have a racial impact statement. So at some point you'll need to bring in Sarah Gone as well for her to present that. I can help out Senator Carney at any point, but I'm not sure she really needs me.
So welcome, Senator Carney. Are you able to join us and talk about LD 372? I'm not hearing you, Senator.
I know, and I tell people that all day, every day. So I'm sorry I goofed. Thank you,
Me too.
everyone. It's a pleasure to be with your committee. I think what I'd like to do is I asked Anna if she could email you all a PDF document that provided some additional information on LD 372. And I know you've got a lot on your plates today. I hope you all received it. And what I'd like to do is to just focus on something that we haven't spoken about regarding this bill, and that I think as I've continued to work on it has really come to my attention as probably the most important element of this bill. So what CHIP expansion would do, it would take advantage of all of the federal matching funds and cover families with incomes between 200 and 300% of poverty. What this means for a family of four is that the family income would be between $53,000 and $79,000. So that group, those are Maine's working families. And I think it's important for us to think about this bill in that context. One thing that really jumped out at me this fall when I was doing some speaking engagement with the Portland Regional Chamber of Commerce was a statement that kind of underlines a lot of their legislative priorities. And I'll just read the quote that's in the materials. It says that one of their priorities is to keep Maine competitive with the rest of the New England region. And I think that's a really good way to look at LD 372. When you look at the New England region, we are not competing for families, working families with kids, because we're not offering the same public health insurance, the same CHIP benefit that our New England neighbors are offering. And you can see that on the map that's at the top of page 2 of the handout. And you can also see the consequence that this lack of coverage has for Maine kids. If you look at the second map at the bottom of page 2, you'll see that you actually have to go as far west as Indiana and as far south as South Carolina to find a state that has a higher rate of uninsured kids than Maine. And so I want to talk a little bit, just focusing really on working parents who can't afford to provide health insurance to their kids. Because again, that's really what this 200 to 300% of poverty is focused on. So first of all, the family glitch. I don't know how familiar you are with the family glitch, but basically under marketplace rules, employees are determined to have affordable employer-sponsored insurance and are therefore not eligible for subsidies under the marketplace by focusing just on the subsidy for the employed parent. And so you could have a very affordable policy for one working parent in the family, but the coverage that that working parent would have to pay for children is so high that it's actually not affordable. That's why they call this the family glitch, because the great employer-sponsored coverage that is offered to the working parent actually makes it hard, if not impossible, for the working parent to then afford to pay for insurance for the children. And yet that parent currently is not eligible to cover those kids under CHIP. Also, marketplace policies are actually quite high and not affordable to a lot of parents, particularly if you're looking for a policy that has a lower deductible. Then there's a group of families for whom the marketplace policies just don't work. Those are families who have children with significant medical conditions, like, for example, children with diabetes, children who need other kind of specialized healthcare like audiology, hearing aids, for example, dental care, mental health care. CHIP even covers things like occupational therapy that helps kids become successful learners by the time they get to school. So those are all of the reasons why CHIP for this group of working families is really crucial, both for those families and also for us as a state. Makes it affordable for people to move here and take jobs and work. I also wanted to talk a little bit about the geographic disparities in access to health coverage. If you look at the bottom of page 3, and there is a typo in my final bullet, but if you look at the bottom of page 3, you'll see that the dark blue counties on the map are the counties that have very high rates of uninsured kids. And this CHIP coverage, which in general reduces the number of uninsured kids whenever and wherever it's offered, would reduce uninsured kids in those particular areas. The most impacted counties, most impacted by having uninsured children, is Hancock, Piscataquis, Washington, and Lincoln County. And so we can use primarily federal dollars to fix that problem and get health coverage and health care to those kids. I guess what I'd like to do is to just highlight, because I know you've got a ton to do today. If you want to know more about the concerns with the lack of adequacy of the marketplace policies for kids, which again, those don't provide the child-specific coverage that CHIP provides. It gives dental, mental health care, audiology, occupational therapy. There was just a study in the journal Pediatrics published in January 2002 that highlights the problems that families are having with those marketplace policies that they wouldn't have if they were eligible for CHIP. And it would be very impactful on Maine families with kids, and especially help us bring families back to Maine. And so I thank you for your attention this morning.
Thank you for that additional information and for the work that must have gone into putting that together. Based on that, are there any questions for Senator Carney related to LD 372? So as I remember this bill, correct me if I'm wrong, anybody, we passed this bill and it came back to us, and we passed it with several versions of ought to pass as amended. So Senator Carney, do you want to speak to the sponsor amendment that's marked up and just lead us through the one or two changes?
Yeah, the amendment is really simple. There had been language in the original bill about covering all children. And there was specific language addressing the immigration status of children. That issue was resolved in the change package, that was enacted in the spring of 2021. And so because of the enactment of that statute, that statutory language in conjunction with the budget work, we don't need that language in this bill. And so I struck the language out. And then there was one reference that needed to be changed. And those were the only two changes. And I don't know if it's helpful for you to have Anna address them or not. But
yes, Senator Baldacci.
Thank you, Mr. Chair. I wanted to, first of all, this is a very important piece of legislation. I want to thank Senator Carney for bringing it forward. I wanted to know, with all the amendments that have been made Senator Carney, if Senator Carney could answer in terms of how many new children will be eligible for coverage once this is enacted.
So this estimate is based on work that was done in the 129th. The estimate was that approximately 10,000 children would receive coverage as a result of this change. There are still some parents who have employer-sponsored policies where the supplement for the children is enough so that the parents can afford it. And so those parents probably wouldn't take up this new coverage. But for parents who currently can't afford their kids, they would take up this coverage so that the kids would be covered. And again, that's about 10,000 kids. There are also a group of families who I've heard from, some in my district, and actually some of our fellow legislators, who for them, the enactment of this legislation would increase their family budget by about $3,000 to $3,500 a year. And that is money that those families desperately need. It helps them pay for daycare so that the parents can work. It helps them provide other educational and healthcare needs of their kids. I've also heard that there are families who are intentionally keeping their family income low enough so that they're eligible for CHIP under Maine's current statute. And, you know, that's at odds with our need to build Maine's workforce. And so this would address all of those. That's the kind of the universe of kids and families who would benefit. Thank you for the question.
Are there any other questions of Senator Carney? Yes, Representative Stover. As soon as we can hear you. There we go.
Let me in. I just want to clarify, since we have spent a lot of time in this committee in the past, this session and in previous sessions, talking about children's oral health and the need to have children's oral health accessible and available. And as a person who works for a low-income dental clinic in one of the counties that has the highest rate of children who are uninsured, this would include children's oral health, both in school-based clinics and also in the community, correct?
It absolutely would. And that was when I was talking to one of our legislator friends. He asked me, so would this cover my kids' dental care? And I said, yes. And he was like, wow, we really need that bill.
Thank you. I just wanted to hear you say that.
Yeah, it's an important part of the coverage.
It really is.
You've made Representative Stover's day. Senator Moore?
I'm just curious. Thank you, Senator Carney. I'm just curious what the fiscal note is going to be on this. Because I know before when we were looking at the non-citizens, it was really high and so forth.
Yeah, the fiscal note preliminary estimate from OFPR, and they haven't done the thorough note, but is that it would be an $8 million general fund expenditure, and it would bring in $24 million worth of healthcare coverage.
From the feds.
Yes.
Perfect. Thank you.
That's the 3-to-1. Okay.
It is.
Thank you. Representative Lemelin.
Thank you, Senator. I'm just a little curious how it can have only an $8 million physical note. I'm for the bill. I think it's fantastic. My problem is the 300%. If you go to 300% above the poverty level, you are talking about 80% of Mainers qualify for this. So basically, almost every single person in Maine will be able to apply for the CHIP program. And that is something that I am quite sure that Luke and everybody else is not taking into consideration. They're just taking into consideration certain groups of people. But absolutely 90% of the people that live in my district will qualify for this CHIP program. Almost every teacher in Maine qualifies for this CHIP program with 300% over the poverty level. And one thing that the senator said was that New England, we want to get it to 300% to match New England. And one thing we have to take into consideration is outside of Maine or northern New Hampshire or northern Vermont, all of New England and everywhere south to South Carolina and everywhere west to Indiana, the cost of living to live in these places is 3 times what it is in Portland, let alone the rest of Maine. To make $65,000 a year, if I'm a single parent with 2 kids, living in Chelsea, I'm a pretty rich person. Living in Portland, Maine, I'm doing okay. The reason that they have to go to 300% in places like Connecticut or Boston or New York or New Jersey or Washington, D.C. is because they have to. Because $60,000 a year in those places, you're definitely poor and can't afford care. Here in Maine, it's totally different. And I'm willing to bet, I'll bet my paycheck that the fiscal note on this is going to be 5 to 10 times what we just heard. Because as soon as people find out that right now, the average person doesn't know that they can apply for CHIP. And once they find out that it's 300% above the poverty level, 80% of Mainers, like I said, are going to apply for this. That's my only concern. As far as the program, Senator Carney, I think you're doing a great thing here. I just oppose the 300% because it involves every Mainer. And the cost of living in South Carolina, okay, it's similar to Maine. The cost of living in, similar to Portland, Maine. Cost of living in Indiana, I lived there, went to school at Purdue. It's similar to Portland, Maine, but not the rest of these areas that we're comparing to. So I just wanted to share that comment. Thank you.
Thank you, Representative Lemlin. Are there any questions of Senator Carney? Did you want to respond to those concerns or no?
Yeah, I actually would like to, because I appreciate what you're saying, Representative Lemlin. And as I dug into this, there are some nuances to it. So one thing is that there are some families for whom it will be economically advantageous to not take CHIP, but to pursue a marketplace policy, because the subsidy for a family of 4 versus a subsidy just for parents is different. And so each family will have to take into account what a marketplace policy would cost them, and then also take into account what are the significant healthcare needs of their kids. So like a family might decide this year that a marketplace policy would work for them, and then have a child who develops a chronic illness. And then the marketplace policy would not be adequate for them because the coverage is so much more narrow. And so those parents might decide that it's important to accept the broader coverage of CHIP and forego some of the subsidy. I hear you. It's actually, as I dug into it, there are reasons why people wouldn't uptake this. But the other point is that the CHIP coverage, unlike a private insurance policy, provides coverage for all of the things that help get kids ready for school, like hearing aids if they need hearing aids. It gives them dental care to make sure that they have good oral hygiene. It gives them glasses if they need to be able to see the chalkboard when they get to school. I don't even know if schools still have chalkboards, the whiteboard. But it gives kids a lot more than a marketplace policy, and parents who are paying for those marketplace policies don't have the money to do those other things like dental care.
Thank you, Senator Carney. Are there any other questions, comments? That being the case, are we ready to vote on this? So I'd entertain a motion. Anna.
I'm sorry. I just don't want you to forget about the racial impact statement. I realize that it's on the original bill.
Yeah.
I think it's required to be presented. I don't actually care when you do it, but I don't want you to forget.
No, I think we should hear it first. So did you bring in
Sarah
Bone?
Goodwin, yeah. And I do just want to remind you what's on the original bill.
Yes.
She's on her way, Senator.
Thank you. Welcome.
Hello
Good
again. I think I saw many of you earlier this week.
You did. We're still here.
Yes, as am I. Although I actually went into my office yesterday. Y'all didn't get to see that, so you still get to see my lovely home office. So thank you for having me. My name is Sarah Kershills-Gone. I am a senior research associate at the Cutler Institute for Health and Social Policy, which is the research arm of the Muskie School of the University of Southern Maine. We are one group of folks who were brought in to help with this impact pilot project, offering some of the resources of the university system to provide some of these initial analyses, really to test the waters for what this process could look like. And so these are representative of our first attempts at what this type of impact statement could look like. And that process is still being finalized. Like I said, this is a pilot. So we were tasked with doing a couple different bills, including LD 372. And yes, we analyzed the original bill because amendments happen. And one of the things before we even get into some of the findings on this bill that I want to go over is some of the challenges with getting data and information at the level of this bill using the sources that we have available. One of the challenges that we face is that, as you probably well know, health data is highly protected and private data. So in order to do something quickly with a short amount of time, we often have to rely on publicly available data or data that have already been analyzed by other folks, which don't always allow us to have the nuance to dig into the actual question at hand, or might be a little bit out of date, or might not have quite the categories or the level of specificity that we would be after. And that's just a challenge because the raw data or the data behind all of these things is highly protected, right? Because we have the HIPAA protections for privacy and confidentiality. For some of the publicly available data sources, we still have confidentiality restrictions for looking at the raw individual level data. So that was definitely a challenge that we came up against. One of the other pieces is the chronic challenge in Maine of the low numbers. When you start slicing and dicing your data into different sections and subsections and disaggregating the information, your numbers start getting smaller and smaller and smaller. So if we're talking about gender by income, by age, we're looking at a smaller pool of people in our data. And sometimes that gets down to a point where a publicly available data source can't even reveal that information. And it also means that the data and the information are less precise. So all of those are things that we had to kind of navigate and think about as we came up with what a potential racial impact statement could even look like. The last challenge that we kind of faced again is that, you know, many of the components of at least the original bill, in terms of removing some of the barriers to enrollment, the premiums, and some of those pieces, which may or may not still be in the bill as it is currently being considered. But some of those pieces are pieces of information that are held within the Department of Health and Human Services. And again, we didn't have the mechanisms in place to get access to that information to look at the enrollments and the applications and enrollments and the time duration by certain demographic characteristics would be something we would be interested in looking at. And we really couldn't because we don't have access to that level of data and would need to execute some sort of agreement with the department before we could get that. However, we were able to look at some of the publicly available census data. I actually had to go to the state economist, who's an expert in this work, and say, where do I go to get some of these data at this very granular level? And she was very helpful. What we were able to pull from that is that, at least in particular, related to expanding the eligibility threshold to the 200 to 300 range, we found that in terms of that racial impact, of approximately 2,000 BIPOC children under the age of 21 could become newly eligible for health insurance who were not previously eligible. This is compared to actually about 13,000 white children who would also potentially become newly eligible. And one of the key things that we found as we were trying to explore this issue was that when we looked at some of these things as a percentage, we realized that this was almost half of BIPOC children living within 200 to 300% of poverty, who may be uninsured and could become newly eligible. And that was a much lower rate among the white children. So that would be about 23.5% among white children who are living within that range, who could be uninsured and become eligible for this program. So that was certainly a notable disparity, and it's helpful to put this into the percentages instead of the raw numbers, because that helps us just have a better unit for comparison. So it certainly aligns with what we see with the national research, which is, definitely shows that there are disparities among different racial groups in terms of their access to health insurance. And this would certainly expand access for a number of BIPOC children who live in Maine. So that was some of our conclusion. We couldn't analyze all of the components and nuances of the bill. These are kind of rough estimates using the best available data. But we do also note that this aligns with some of the national research and national trends that are being uncovered by multiple researchers. So I would be happy to try to answer any questions that you might have about the work that we are able to do. And I thank you for your time.
Thank you for your analysis and digging. And are there any questions of Ms. Cohn? I'm not seeing any. So, Senator Baldacci.
Not a question, just a comment. I want to thank our witness for her excellent testimony and for the work. This was a product of the State and Local Government Committee, the racial impact statements, and I'm glad that they're being used. I think they're going to be very helpful, and I think they're very helpful in this bill. So I just wanted to thank you for your work.
Thank you. I appreciate that.
All right. So I think we have all the information we're going to about consideration of LD 372. At this point, I'd entertain a motion. Representative Craven.
Thank you, Mr. Chair. I move ought to pass as amended.
Is there a second?
I second that.
Very good. Thank you. And that was Representative Javner. Is that who I heard? Thank you. So it's been moved by Representative Craven, seconded by Representative Javner, seconded. Are there any other discussion to be had? I'm not seeing any. So Karen, it's your turn to collect the vote.
Thank you, Senator.
The motion on the floor being ought to pass as amended. The amendments being the sponsors amendments that we got a copy of with the handwritten notes.
All right, sounds good. Representative Zager. Representative Zager is absent. Representative Lemlin.
No.
Representative Lemlin, no. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Craven.
Yes.
Representative Craven, yes. Representative Connor. Representative Connor is absent. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Javner.
Yes.
Representative Javner, yes. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes.
So that is 10 in favor, 1 opposed, and 2 absent currently. So Representative Lemelin, I'm going to remember this time to ask about the minority report. Somebody should put that on the calendar. It's near the end of the term, and I finally remembered.
Well done, Senator.
Representative Lemelin, do you have a minority report?
Yeah, I don't. My only concern here, Senator, is the 300%. If we could get it amended to 200% or less, I'd be in favor of it. So,
would you settle for 200% just for round numbers and make it ought to pass with that amendment?
yes, that would be acceptable.
Yes.
Okay,
Yeah.
I was going to ask if you wanted last year's amendment, but that's the 200%. Plus, there were a couple of other pieces in it. If you would like me to tell you what they are, Representative Lemon, I'm happy to do that, or you can just have the 200%.
What are the other pieces? I'd love to hear them.
Okay, so this is what the minority amendment was before it went to the floor last year, bearing in mind that it included taking out the immigrants, which is removed anyway because it's I'm assuming you want to continue to remove that, but that was in the budget. You also had the eligibility not being subject to an asset test. Oh, that actually is a cleanup. Removing the requirement to provide coverage to persons 19 and 20 years of age and to non-citizens, which obviously you would be removing in the same way that the sponsor is. And then the last one was removing the requirement that the department seek federal funds for outreach activities and removes the goal of the outreach activities. It's your course.
Yeah. I don't mind leaving it the way Senator Carney has it now, just knock it down to 200%.
Okay, so I will remove the piece that Senator Carney has removed from her amendment and we'll remove, I'm sorry, you know what I'm trying to say, right? And then also the 200%. Okay, thank you.
Yes, thank you.
Thank you, Representative Lemelin. Okay, Representative Carney, thank you for your efforts.
Thank you, everyone, for all your hard work today and every day. It's a pleasure to be here.
Right. So it's we have time now to go to consideration of LD 1574. And Representative Meyer, do you want to start or do you want to turn it over to Anna?
Well, I'll turn it over to Anna. I'd also like to, thank you, Senator. I'd also like to remind the committee that there is a racial impact statement on this bill as well. So we might want to invite Mr. Cobo Lewis in to deliver that as well.
Done. So Anna?
I don't have anything new for you. We did ask for an update from the department and you got a memo plus from Molly. I don't remember if it was this morning or last night, but also I do believe that Director Saucier is in the waiting room as well, if you would like him to go over what is in that memo. But I don't have anything personally for you.
So I'll defer to Molly if you want to come on camera and introduce yourself, and then I'll let you help us figure out who the next person to help is.
Sure, thank you. Good morning. I'm Molly Bogart, Director of Government Relations, and you will definitely want Director Saucier to be the one to walk you through the memo. So he's available whenever you get there.
If that's the direction we're going to go, we have done, the advocates and I have done some work around an amendment to the bill. So I can launch into that, or we can allow Mr. Cobo Lewis to do his presentation.
Your bill, which would you prefer?
So why don't I just get started and let you know about some of the more recent work that's been done on 1574. So the committee will recall that this bill was introduced and carried over from the first session. But it is work that we've been doing around this particular population of folks with high IDD folks with high behavioral needs. So 1574 would have established an additional rate to support services for adults with IDD who have complex behaviors, high needs. What the IDD advocates and I are proposing is that we narrow the focus of the bill on an increased rate for only individuals with behavioral management plans. And this would then alleviate the ask for the department to create an entirely new rate. For additional information around this amendment that would replace 1574, I would ask, and I see Ms. Cordes and Ms. Putnam are here, to provide a little bit more information to the committee around the details.
Ms. Cordes, did you want to offer her something?
Good morning, Senator Claxton, members of the committee, and thank you, Representative Meyer, for your sponsorship of this bill. I do, that this speaks to the need to establish the support for adults with IDD who have complex high behavioral needs. It's work that this committee began in the 129th. The current rate does not support specialized staff that the state requires to oversee approved behavior management plans or the cost of directly supporting people in homes that require specialized changes. The net effect of using one rate for everyone has created an inequitable system of care where providers who do care for people with complex needs often end up doing so at the expense of the care and support needed for others. This has made it less likely that providers are able to support other main care members with higher needs or maintain the expertise that they so want to be able to fulfill their mission to support all members of the IDD community. The state in some cases cannot find providers who have that expertise or private funding to care for persons with complex needs, so they are supporting them currently out of state. And looking back at last year and the department's concerns about providing a higher rate to providers working with people with either positive support plans or behavior management plans in numerous settings, finding some common ground or at least narrowing the focus is the thought about how to move forward with supporting providers and people with IDD with higher needs. So an amendment would narrow the scope of the bill to provide a higher rate to only individuals with behavior management plans approved by what's known as the three-person committee, thereby making sure that the department who sits on that three-person committee is part of the decision-making. That committee also includes a representative from OAB and DRM. And it's also, we recognize the department as they're moving through rate system reform, does not desire to create yet another rate. So we're proposing that the Section 21 agency home support medical add-on be adjusted or expanded to be used for providers of residential services who are supporting main care members with behavior management plans. So unlike the current medical add-on, which could be a component of several services, again, this proposal would be to expand the medical add-on rate only for use with main care members with behavior management plans. And I can appreciate that you'll hear from Director Saucier and the department, and I applaud their good work and working with the University of New Hampshire and their own crisis system to partner for the START program. I'm very excited about that initiative, but the ability of providers to have the cost to do the day-to-day work right now while the department is doing its own analysis and maybe planning for future to look at value-based purchasing as or around the service, I should say. That's down the road. We're really looking for a bridge to keep more people out of crisis, out of hospitals, and to be able to support folks here in Maine. Thank you.
Thank you for that. You also, I heard that Jennifer Putnam might have something to contribute to this conversation. Welcome.
Hi, thank you. I just wanted to add that some context here. The situation is dire right now in terms of providers and provider capacity to care for people with significant behavior issues. When you've been reading the newspaper and watching TV about the crises that are going on in the emergency departments across Maine, those are our individuals. Those are people with intellectual disabilities and autism that aren't able to be cared for by providers right now. And the other thing I wanted to add is that we're talking about 100 people. So that's how many people have a behavior management plan. We're not talking about thousands of people. We're talking about right around 100 people at any given time that would have this added rate. So thank you.
And those are people who are not currently have access to that existing rate.
Correct. They have the basic rate that everyone else has in agency home supports.
Okay. I also see that Katie Fulham Harris, you had something to contribute to this, please.
Thank you. Yes, I appreciate the opportunity to speak. Senator Claxton, Representative Meyer, and the committee. We actually supported this bill last year when it first came out. And since then, we have seen the disintegration of the system for these individuals. I think we strongly support the need for enhanced revenue for those providers, but enhanced staffing, enhanced ability for us to be able to transition individuals who are literally every day being dropped off at the emergency department, many who have significant behavioral health challenges who fit into this category of having IDD and autism, and desperately need to be in a more appropriate setting. So strongly support this, and anything that we can do to help, we would be willing to do.
Thank you. Thank you, Katie. I also see that Lauren Willie thought that she might be able to help us here.
Good morning, everyone. Thank you very much for having me. My name is Lauren Willie. I'm from Disability Rights Maine, and I just wanted to add to the conversation. Ms. Putnam mentioned the behavior management review teams, and DRM is one of those people that sits on the review team. So I just wanted to add a little bit of our perspective as someone who sits on those review teams. We did present testimony last session in opposition to this bill. I'm hearing what the amendment is, and I just want to say we would still oppose this bill. We still have really big concerns about, even when you narrow it to people that have behavior management plans, the system that surrounds people that have behavior management plans is fundamentally very problematic. Behavior management plans really are plans that restrict people's rights as a way to manage their behavior. In my experience sitting on these teams, they are not really ways to support people and to help them live better lives and to decrease the challenging behaviors. The plans tend to exist in perpetuity. So my real concern, and we raised this concern in our original testimony last session, is that increasing funding for people that have behavior management plans, I think, is, unintentionally could be creating incentive for providers to get behavior management plans. So I realize that the number for people with approved plans hovers right now at around 100. I don't think that that includes, there are many providers that I'm aware of that acknowledge that they serve people that they would love to put behavior management plans in place for. I think that I don't think there probably will be any disagreement that there is a high staff turnover rate, there's a crisis shortage, and a lot of these reasons factor into the reason why people have behavior management plans. So we have really big concerns that increasing funding specifically to serve people who have behavior management plans is going to create an incentive to get more behavior management plans and to continue the ones that do exist.
Thank you for your testimony. Molly, do you have anything you wanted to contribute at this point, or before I go to Director Saucier?
No, he can take the lead for us. Thank you.
Welcome, sir.
Thank you, Senator and committee members. First of all, let me just say this is a high priority for us. We've acknowledged before and continue to acknowledge that we need to make more effective the parts of our system that help support people with significant behavioral challenges. The concerns that we continue to have with the bill are that I don't think it would achieve the outcomes people are looking for. I'm concerned about more than the 100 people who have behavioral plans. We need to be more effective as a system in how we support and interact people with challenges, whether they have plans or not. And we don't have consensus within our system among our stakeholders as to what the best approach would be. It's a very complex approach that includes qualifications of staff and certainly the resources that providers have available to them, the training that we provide and that is otherwise provided, et cetera. So a lot of really complex issues to look at, which is why we've asked the UNH START Center to do an assessment of our system that includes all of the stakeholders involved, and that work is beginning now. We have, based on they'll do a couple of things. They'll do a lot of process with various stakeholders to gather more information about the contours and the nature of the issues. They will analyze main care data for individuals who do exhibit these behaviors, and then they'll make a set of recommendations. We've set aside some of the ARPA funding available under Section 9817, that's the 10% enhanced FMAP money, to then address the priority gaps that they come up with. And we would be able to use that money to pilot various approaches to this issue. I share the concern that tagging extra payment to a behavior plan provides an incentive that may be perverted in some cases. It's not how we would structure a payment around this. And in terms of the additional things that we're doing, we are working with Dr. Siegel at Maine Health he's interested in helping us create a training program around this for our providers. And so lots of irons in the fire, and much more to do on this, but we're really looking for a comprehensive approach here that will actually get us the outcomes that we're looking for.
Dr. Saucier, can you answer a question I had about whether this section, where COLAs and ramps fit in their reimbursement?
Right, so it's just reviewing what the IDD provider community's recent increases are. As you know, in the biennial budget, there was $32 million the general increase that was implemented and that the providers have received. And then a couple of weeks ago, we finished our the bonus payment initiative that $56 million of that went to the IDD provider community as well. So far this year, $88 million in increases have been implemented. And then once the supplemental budget is decided upon, they would be slated to receive the 125% back to up of minimum wage back to January, plus the 4.9% COLA.
Thank you for that clarification. Are there, yes, Representative Perry?
Thank you. During the budget hearing that we were at, there was some mention of, now I may get this wrong, of a rebasing of rates or something, that the administrative rate got decreased. Is that what happened? Or so that they ended up losing money instead of gaining money? And what was that and how did that happen?
I think that's a bigger question. And I think what we really are focused on is this particular bill and the intent to expand an existing medical add-on. So if we can focus on that for right now.
I'll save that for the budget discussion.
Very good. All right. I did see that Jennifer Putnam, you had your hand up. Are there any last thoughts that you want to share with us before we move to Ellen Cobo-Lewis?
Yes, thank you. We provide services to almost 80 individuals with intellectual disabilities and autism in the residential setting that we're talking about today. We have a number of folks who have high behaviors. I can tell you all of the providers that I'm aware of would never be incentivized to create behavior management plans, issues, or anything else in order to receive additional support. We have issues of structural problems in terms of people, property destruction, needing plexiglass instead of regular window glass in a home, needing to protect other individuals in a home, needing to ensure safety and additional training and support for all of the staff. There are a myriad issues that come with people with higher behavioral needs. I'm trying not to be offended by here today, but I can tell you that what is happening right now in our system and what Katie Fulham Harris was referencing is that we have a disincentive because we are unable to staff these homes. We're unable to take care of people in these homes, and we need some help. And we have needed help for quite a long time. And that need is not going to wait until another study is.
Let me ask a question then, because you're on the ground. Has the 56 million or the 32 million gotten to you in a form that's usable to help address some of these issues?
Yes, so we just got the bonus payments a couple of weeks ago, the first payment and then the second payment came. We had already pushed those out to our staff last September and floated the cost because we couldn't wait. So it has been very helpful for us, but that applies to all of our direct care workers, not just the ones who are working with people with high behavior needs.
Okay, thank you for clarification. All right, so let's go to Alan Cobo-Lewis and hear from him. Welcome.
Thank you, Mr. Chairman. So I'm hearing the discussion at the work session. I'm going to go in a little bit different direction of summarizing the key aspects of the preliminary racial impact statement. So first of all, I just want to say up front, I was one of the proponents of the bill. I'm doing the racial impact statement from just a point of view of analyzing the racial impact, not taking a position on the bill. So I'm referencing footnote 2 as someone who has taken a previous position. First of all, I just want to note that much as Ms. Goen experienced, there was a lack of data in addressing the racial impact of the specific issue in the bill. So the impact statement ends up being longer because I was trying to bring in issues that are related to that core issue, because the core issue was actually difficult to assess the racial impact of. Basically, there's lots of racial disparities. There's racial disparities in access to services that are quite significant nationwide. There's some racial disparities in identifying whether behavior and how to react to behavior. Interestingly enough, nationwide, Black people actually are less likely to have behavior support, possibly because they may be undiagnosed. Possibly because there's disparities in whether or not they have a psychiatric diagnosis, which could lead to different kinds of treatment. So the big picture is that we need data. We would need data about the impact of regardless of whether you pass this bill. On the very last page of the racial impact statement, there are some specific recommendations about the kind of administrative data that Maine could collect and should collect, and suggestions about how to analyze it. And those data should be collected regardless whether this bill passes or not. Data and the basic themes are people spending more time on a behavior management plan or not? We don't currently have data about that. And are there racial disparities in that? Are people getting more or less access to the community? In response to this policy, or in response to being on behavior management plans, et cetera. So those are the kinds of things that have to be addressed. And currently, I think there is some. Well, I think I know from speaking to Director Saucier, there's definitely some efforts to collect basic data, but the data absolutely have to be collected in order to evaluate any policy going forward, regardless whether it's the policy in LD 1574. And the data have to be analyzed in order to address the effectiveness of any policy and the effect on access to the community and rights restrictions.
Thank you. That's why this is a pilot and not launched broadly as we learn what's doable. Are there additional comments?
I'm sorry, Mr. Chairman. Thank you. I apologize for interrupting. I just realized that there was one a specific recommendation I wanted to bring forward, which was the department suspended participation in one of the national studies to check on quality called National Core Indicators because of the pandemic. I think some specific recommendations beyond the administrative data in the last page of the testimony would be to resume participation in national programs to collect those data. Potentially, the state can actually add its own questions to the National Core Indicators study, so that the department may want to consider adding questions pertaining to racial impacts of policies like this. In addition, there's some work being done at the University Center for Excellence in Vulnerable Disabilities in Minnesota for improved quality monitoring metrics. They're being piloted now, expect to be available for rollout in probably a year and a half. I would suggest that the department could actually potentially participate in that as a way of supplementing the administrative data with broader data from querying people receiving services if they're adequate or not.
Thank you for sharing that additional piece that I was trying to unintentionally exclude. Yes, Laura Cordes, you had your hand up.
Thank you. I appreciate the opportunity to speak again. With the discussion about what is an incentive, what is not, and the idea that it would be a perversion or incentive to actually pay providers to do what we need to do and what our focus is, and that's to support people with intellectual and developmental disabilities with positive support plans to have the lives that they so deserve. It's really disappointing to hear those comments today. And I just wanted to leave you with the ODE's own report that this committee, through legislation in 2019, required, and that came out in 2020. And that report found that the current rate structure for main care waiver programs for person with intellectual disabilities or autism does not include an incentive for agencies to invest in specialized staff or other resources to successfully manage challenging behaviors. I know we're at a disagreement of how to get there. I still believe that we will all work together to get there, but certainly finding the bridge to do that sooner for the people we support. I ask for your support in doing that with this bill. Thank you.
Thank you. Representative Meyer.
Thank you, Mr. Chair. I want to echo what Ms. Cordes and Ms. Putnam have articulated in that it is insulting to speculate that that there would be an incentive to label individuals who are not high needs or having complex behaviors as such should this rate be adjusted accordingly to reflect the expertise necessary to care for these individuals. Our experience with those providing care to this vulnerable, high-risk population would not suggest that that would be the case. I realize, having proudly been a member of this committee now for my 2 terms here in the legislature, that raising rates in an ad hoc patchwork manner is not what we want to be doing. And we are working very hard to standardize that process and to avoid having to do things like I am asking this committee to do now. But I am asking for your support on the amended version of 1574. And thank you for the time and attention the committee's given, and to everyone who's participated here today.
Thank you. Director Saucier, you had your hand up earlier. Did you want to make any comments?
Yeah, just a few other comments for the committee. It is true, and we have said that we would like to develop a more sophisticated rate setting methodology that provides the right incentives, perhaps in a value-based payment context. But just so people are clear, we do provide greater reimbursement for people with serious behavior. It's just, we all agree it's not the right kind of reimbursement. So what happens today is if you approach the department for additional staffing, and additional staffing is authorized. So we often do 1-to-1 staffing, 2-to-1 staffing. And so there is more support. What we need to do is figure out a way to get the support with more specialized training, and a lot of work is going on with that. And certainly, no intention to impugn the motivations of anybody, but I mean, there are 100 people in our system with behavior plans. So if that's going to be the trigger for this payment, and if there are no additional behavior plans, it's not going to address the problem, right? We serve over 6,000 people in this system. Many of them have behavioral challenges, and we're looking for a much more comprehensive approach to infuse our whole system with a better understanding and better competency to address these needs.
Thank you. Representative Madigan?
I just want to say I'm going to support this. I want to echo what Representative Meyer said. The reality is that this is a problem we've all known about for a number of years. And the ripples of this problem are something we've continued to hear about. We've all heard the stories of the emergency rooms and difficulty hiring staff. As someone who has supervised people, and my first job being in a residential program, you need specialized staff to deal with people who have some of these behavior challenges. It does require more training. It does require more support. And I think that I commend the department for doing what they're doing, but I think what we need to do is make sure these folks don't wind up in emergency rooms and being held in places that are not appropriate places for care. Thank you.
Thank you. Yes, Senator Baldacci.
Thank you, Mr. Chairman. I did have a couple of questions or comments for Director Saucier, but the basic, let's assume, Director Saucier, that we pass this, because that's our job as a legislature, is to make the final decisions regarding policy. You know, I would expect that this to be promptly implemented. And I say that from the context that I've been concerned about how long it has taken to fully fund the wage increases that we approved last year. And then the second comment is that I understand that the department's working on this, and I appreciate that. And no one is saying that this bill is a perfect bill, but what I am hearing from people is that this will be helpful to many people and many families in very difficult circumstances. So I'm going to be voting for this bill, but I just want the department to know they can continue working on improvements and modifications. But if we pass this bill, we would expect that the funding, that the implementation of it happen as soon as possible. Mr. Chairman, thank you. I appreciate everyone's time.
I do think it's fair to note that some of the reason for the delay was based in the legislature itself and in some of our financial projections and not in the department. So I do feel obliged to note that. Representative Molly, did you have something you wanted to contribute?
Thank you, Senator, and thank you, Senator Baldacci. I really wanted to note what you noted, Senator Claxton. We've had a number of conversations with this committee and with appropriations about the 125% and Part Quadruple A, and wanted to be clear that we're excited and grateful for the partnership in addressing those issues, but that is not a result of the department dragging its feet. And I wanted to make sure that there was a commitment on Mike that we work diligently to implement what is passed, and certainly would not intentionally create any delay there. Thank you.
Thank you. So I think we've heard the information that's of value in considering this. At this point, are there any additional comments or questions to be made before I entertain a motion on the bill? So it's amended, and
Mr. Chairman, I would move ought to pass as amended.
Thank you, Senator Baldacci.
Second.
Thank you, Representative Craven, for the second. Any additional discussion? Then I would, Anna.
I'm sorry, I just want to ask a couple of clarifying questions. And if you don't mind, I'm just going to bring up the original bill just so I can be clear on what I'm drafting. Is that okay?
Sure.
Okay. Let me just find it. I think you should be looking at this now. So I just want to make sure I understand what we're doing. I think I know what we're doing, but I want to make sure. So this bill currently has an emergency preamble. I'm assuming that that stays. This section 1 will go away because I don't think it's necessary anymore. And this section 2 would become a requirement for the medical add-on rate to be applied to folks who have behavior management plans. And I just want to clarify, and I'm hoping somebody out there in either the waiting room or Director Saucier will just confirm that it is still that particular department rule that you can see there, because I'm not 100% sure or whether that is in fact under a different 21 or something else rule.
Director Saucier, did you want to address that? My understanding was that there's already existing medical add-on, and this
But
would be.
which section is what I'm asking?
I understand, but it isn't multiple rates, an expansion of existing rate. What's the point I was trying to make? Director Saucier?
I think that, just the technical response for the drafting, if you say medical add-on rate in waiver services, then I'm not sure if it's included in 29, to be honest with you, Anna, but I know it is in 21. And then
Okay.
And just on another note, I mean, I would note that medical add-on rate is for something entirely different, right? So that would be one of our concerns with this amendment. It's for nursing time and things that people with medical needs need. And so this is not how we would approach a rate for behavioral needs.
Thank you. Does that get you what you needed, Anna, or are there additional concerns? Okay. So I'm not seeing any other comments or thoughts. Hang on a minute while I check. All right. So there's a motion on the floor. It's been seconded. The motion is ought to pass as amended. And I would turn to Karen to collect the vote.
Thank you, Senator. Representative Zager. Representative Zager is absent. Representative Lemlin.
No.
Representative Lemlin, no. Representative Stover. Representative Stover is absent. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Craven.
Yes.
Representative Craven, yes. Representative Connor. Representative Connor is absent. Representative Griffin.
No.
Representative Griffin, no. Representative Javner.
No.
Representative Javner, no. Senator Moore.
No.
Senator Moore, no. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
No.
Senator Claxton, no.
So that is 5-4, 5 against, and 2 absent, but I'm missing somebody there.
I have 5-5 with 3 absent.
3 absent, okay. So we'll leave the voting open for the 48 hours as we do.
I do need the other motion though, so that people know that what their 2 options are.
So the people voting
more than
no,
2.
if you're one of the people voting no, what would be your report?
Not to pass.
Okay, does that get you what you need, Anna?
Yes, is that you too, Senator Claxton?
Yes. Okay, so I have not seen evidence that our justice has arrived yet, unless Karen's going to tell me otherwise.
Senator Claxton, I have been in touch, and she said that she was going to join. I said that if I was looking for her at a time and we did not see her, I will call her. So if I could have just a couple of minutes to do that right now, that would be great.
Why don't we take a break until 11:30, and we'll reconvene then and see if we can chase down the justice, and then we'll have a discussion about LD 1968.
Thank you.
So Karen, is there any follow-up on
She is,
communication?
yes, she is in the attendee list and ready when you want her to be, when the committee's ready for her.
Why don't you plan on bringing her right over?
Promoting her now.
Welcome, Justice Mills.
Thank you very much.
Do you want us to see you, or do you want to stay up as your name?
I want you to see me.
Okay, let's start with the basic questions first. And can you tell us a bit about your time constraints so we can try and respect those? And thank you for being here.
Thank you for allowing me to be here. I am working in my chambers today, so I have no constraints.
Okay. Then that being the case, I would suggest we go to Anna for consideration of this LD 1968.
I actually don't have anything for you. I was assuming that you would start with Justice Mills and her work on the languishing committee.
Okay. All right. So we'll keep it at a different level than bill level specific. Justice Mills, we've been considering the recommendations that came out of the languishing committee, as I understand it.
Yes.
And I understand you were intimately involved in that committee. Would you like to speak to what your assessment is of how this bill addresses the needs that you surfaced in that committee?
I'm particularly focused, if I may, on section 4 of LD 1968. If I may.
Please go right ahead.
All right, thank you. Senator Claxton, Representative Meyer, members of the committee. My name is Nancy Mills. I served as a district court judge and a superior court justice for 28 years. I took active retired status in 2020. Improving the treatment of mentally ill defendants in the criminal justice system has been a significant focus of my judicial career. I presided over the AmHigh consent decree for years. I founded the first and still only co-occurring disorders court and 2 veterans courts in Maine. In 2017, with the help of others, I began the languishing committee. And in 2018, I began in Portland, the first mental health docket in Maine, which is now being replicated in counties around Maine. I know you are very busy, and as I said, I appreciate the chance to speak with you about only Section 4 of LD 1968, 2 amendments to Title 15, Section 101D. The proposed amendment would first add community supervision by an ACT team of a defendant committed to the custody of the Commissioner of the Department of Health and Human Services as an appropriate placement. Vastly more importantly, the proposed amendment would provide a deadline of 30 days for the commissioner to make an appropriate placement for a defendant after a judge has ordered a commitment. As background, the languishing committee consists of members of law enforcement, the district attorney's office, the defense bar, Maine pretrial services, representatives from the jail, state forensic service, and other agencies. The committee meets bi-weekly. The primary goal, and really the only goal, of the languishing committee is to prevent acutely mentally ill defendants from languishing in the jail and to secure their release from the jail to an appropriate placement. Acutely mentally ill for us does not mean every defendant with a serious mental health diagnosis. That would include, I suspect, a large percentage of the populations in the jails. We focus instead on defendants at the jail who are in extreme and dire circumstances because of mental illness. Defendants who are not eating or drinking, who are refusing medicine, who are lying naked on the cell floor, who are smearing feces on cell walls, who are causing toilets to overflow, who are screaming, who refuse to meet with treatment providers or their attorneys, who are refusing to leave their cells, who cannot attend court to deal with their charges, who are very likely incompetent, and who are presumed innocent. At each languishing committee, the representatives from the jail provide a list of defendants who are acutely mentally ill and who are doing exceptionally poorly at the jail. The appropriate member of the languishing committee then takes necessary action the next day, either the district attorney, the defense attorney, the clerk, representatives from the State Forensic Service, or me, to alert the people involved in a particular case that expedited action is required. For example, 2 weeks ago, my assignment at the languishing committee was to speak to the justice assigned to a pending murder case. The representatives from the jail said that the defendant in the case was not doing well and truly needed placement at a hospital and treatment. If neither took place, the defendant would never stand trial. I called the justice assigned to the case. He called the attorneys, and they took it from there. This is a murder case after all, and it must be resolved. Too frequently at the languishing committee and on the mental health docket, the same defendants' names are brought up over and over, week after week. The response we hear is that the defendant is, quote, still waiting, quote, for an appropriate placement, and that he is, quote, on the list, quote. We are consistently told that there are sufficient beds for placement. We refer to these as magic beds because, like sleight of hand, the beds disappear when needed. If the beds exist, there can be no objection to a 30-day deadline to find one. Since 2017, the criminal justice system in Cumberland County has done everything within its authority and imagination to improve the plight of these defendants. We meet bi-weekly to determine the defendants who need immediate attention. We have developed expedited processes. We have dedicated mental health docket. We have assigned 2 judges and 2 court clerks to cases involving mentally ill defendants. We have developed a roster of defense attorneys and state's attorneys who understand and want to help these defendants. We work with representatives from the State Forensic Service and the department who are invaluable. And we work with people from the Cumberland County Jail who are superb in their collaboration with us to help these defendants. More than anyone else, the jail personnel know the horrors these mentally ill defendants endure as they wait for placement. But we cannot, unfortunately, make appropriate placements, especially a bed at a hospital, magically appear. That is what we ask you to do now. Adding a deadline of 30 days for a placement after a judge orders a commitment of a defendant to the custody of the commissioner is critical. The importance of this statutory amendment cannot be overstated. There is no time frame in the current statute for when an appropriate placement must be made. That omission provides no guidance to or oversight of the department and offers no hope to the defendants. Acutely mentally ill and incompetent defendants are languishing in the jail for months and months and months. They remain in jail for a longer period of time than any plea offer or sentence after trial would involve because they cannot resolve their cases. This is a circumstance that at least is inhumane. The jails currently are the only entity in Maine that cannot say no to providing placement for mentally ill defendants. If this is not the time to end that reality, when is? One change, please add the 30-day deadline to the statute. The statute now tells the commissioner what to do. This crucial amendment will tell her when she must do it. This would have an immediate positive impact for acutely mentally ill incarcerated defendants. This is Maine, this is 2022, and this is something we can do. we can all do a better job for these defendants who look to you and me, and rightfully so, for help. Thank you for this chance to speak with you, and I would welcome any questions you may have about this important Section 4.
Thank you for that testimony. And to set the context, you were referencing a 4-pager that's labeled additional information for LD 1968 that we were provided with a couple days ago. You were not referencing the proposed amendments, which is a 1-pager, which focuses on permanent supportive housing and reporting on residential bed availability. So I just want people to keep that in mind as they ask questions, unless I have that wrong, Justice Mills.
No, you have that exactly right. Section 4.
Okay, thank you. Representative Javner.
Thank you very much, Senator Claxton. Thank you, Justice Mills, for being with us this morning. You have provided very important information. Thank you for your work. I just have a really simple question about how many people are we talking about that are facing these situations?
Well, my experience is with Cumberland County, of course, but I would say we meet bi-weekly. There can be anywhere from 2 or 3 to 5 or 6 that the jail reports to us about, who are waiting placement and who are in severe circumstances as I described.
Thank you.
Are there other questions that we should be asking of Justice Mills? One of mine was, if we put the 30 days into statute and it's not possible to staff beds enough, does then who becomes non-compliant and who's breaking the law at that point?
Well, I don't like to say that people are breaking the law, but I think if I know the defense lawyers who represent and are dedicated to these defendants, they'll be in court on the 31st day. Filing, I expect a motion for contempt.
And who would be in contempt?
The department.
Okay. Yeah, and the message that we've been hearing loud and clear in committee now for a couple of cycles is that there often are just not people out there to do the work, and therefore there's plenty of beds, but an inadequate number are staffed. And I don't know how, other than to continue to try and make the work more attractive, we can address that issue.
Well, I want to emphasize that the languishing committee was formed in 2017,
okay,
which was long before any of the difficulties of the past 2 years. This is a problem that cannot be defended with the use of the pandemic.
So my colleagues are surprisingly quiet, but so in 2017, when the languaging committee started, I suspect that you heard from Mr. Cullen Ryan about his effort on the FUSE program. Was that raised in committee? Do you remember?
All right.
Do you remember hearing about the FUSE legislation that Cullen Ryan worked so hard on to address it? Okay. So I will be asking him shortly about whether expanding that program would be adequate to address the needs that you've spoken to. Do you have any comments before we get to him?
Housing, we look at housing almost as treatment, and it's really the first place to start with housing. But these defendants need a lot of things. They need health insurance, they need medicine, they need support. What they don't need, and which is my crucial concern, is to be in the Cumberland County Jail with no treatment and no medicine. So the first priority for me is to get them an appropriate placement, which a judge has ordered. And all we are asking is, once that order is in place, it has to be executed within 30 days.
Okay, thank you for that information. Are there any other questions for folks? Senator Baldacci?
Thank you, Mr. Chairman. I also want to thank Justice Mills for her long career in public service and the judiciary. I know she's worked passionately on this issue for a long time. I just wanted to ask, I understand the 30-day deadline, and having been a defense attorney who's had to deal with the Department of Human Services, had to sue the Department of Human Services, had to deal with them in terms of representing clients, that what is the remedy? I mean, I understand the contempt remedy, but I just think we need to, I'm not sure that that's enough of a sanction, but I definitely support what you're trying to do. I just am concerned about how the department could see this and has seen this in the past when we've tried to get medical treatment for an obviously mentally ill prisoner. So I think that the framework is good. I just want to make sure that we have some sort of remedy to make sure that there is the follow through. So that's my only comment, but I sincerely want to thank Justice Mills. I think she's done an outstanding job on so many issues. Thank you.
Thank you very much.
Thank you, Senator Baldacci. Representative Lemelin?
Thank you, Senator. I've been silent because I guess I'm lacking a lot here. I'm misunderstanding the whole system, because this bill seems to be indicating that the court is giving a court order, and what this bill is saying is that we're going to force Maine Housing to provide within 30 days a place for these people to live. My question is, if that is the understanding, I'm blown away. I agree with the Chief Justice 100%, and that is what the Justice, that I agree. These people should not be in jail, and that's a total injustice for them to be there. But why are they not being placed in a psychiatric facility?
Because, as I said, when we raise the issue with the State Forensic Service, we are told that the defendant who has been ordered committed to the custody of the commissioner, we are told that the defendant is on the list for a psychiatric bed, either at Riverview or Dorothea Dix usually, and that he's or she is moving up the list and it will be X days. But that's what we're told.
Okay, so why is this bill not saying something to the effect that these psychiatric hospitals need to make room for these people? I'm all for it.
Well, I don't work at the hospital and I don't work for the Maine State Forensic Service, but I would leave it to them once they realize they have this deadline to take appropriate action. I think they would know more than I what would be needed. What I want is, once the judge has made the order, that time is of the essence.
To get them into housing.
No, to get them an appropriate placement under Title 15, which is, among other things, and usually what they need, a bed at Dorothea Dix or Riverview.
Perfect. Thank you, ma'am.
Yep, they are incompetent. So they need treatment as well as a bed.
I agree with you 100%. Thank you.
Thank you.
Representative Madigan?
Thank you, Mr. Chair. Thank you for joining us this morning, Justice Mills. And
thank you.
I also want to echo Senator Baldacci. Thank you for your years of service dealing with this issue. My question is, when you refer to the beds, two-part question. Are we really talking about only forensic beds, which the only place those exist are in the state hospitals? And then the other piece would be, based on your experience with the consent decree, how does this relate to that? Because not people who wind up in the hospital also need community-based services when they're released from the hospital. And it seems to me that the lack of community services may be getting in the way of people being discharged. I mean, that's something our committee has talked about before, how that kind of makes it the issue of bed availability difficult. So.
Yeah, it is forensic beds that we need because they're coming from the jails. And number two, I should probably tread more lightly than I will. This consent decree was signed in 1989. We're still waiting for community services.
Thank you.
Thank you.
Okay, we spent some time, Justice Mills, in this committee talking about PTP, Progressive Treatment Plan Program. And has that a significant role to play here in this work?
It has a role. It's not a significant role.
Okay.
For us, but it's a good plan.
And that might be what is put in place after somebody leaves the forensic hospital.
That's exactly right.
Not what you need in the settings in which these people find themselves now. Okay.
That's right. They need to get to the hospital, and then, when they're restored, it would be terrific if they could be released to someplace other than the Cumberland County Jail again, because things go downhill fast.
Yeah. Yeah. Okay. So before we let Justice Mills go, are there additional questions that any of this conversation has raised for members of the committee? I'm not seeing any. I too want to add my appreciation of your passion for this work. I think we all do.
Thank you, Senator.
And we will continue to consider. Thank you for being here, and thank you for carving time out of your day.
Thanks for the opportunity. I appreciate it.
I don't see the sponsor joined us. Yes, she has. So I will bring her in, and I wanted to ask some questions of Colin Ryan. If there's somebody else that you all would like to hear from, just let me know and we'll bring them in. Anna, do you want to jump in at some point, or are you content to let this play out? Okay. Representative Ross, welcome.
Good morning.
I don't know how much of Justice Mills' testimony you heard. She was focusing on some elements that are not currently, as I read this, in the proposed amendments. And mostly it's access to forensic beds.
I may be able to help clarify some of that.
Sure.
The concept draft that served as the basis for the public hearing that we had contained 4 discrete sections. The amendment that you received just recently, the most recently, the 1 page, allows us to categorize the 4 sections in the following way. We took section 1 and section 2 from the concept draft, which was housing and services, and we combined them. So sections 1 and 2, which were housing, permanent supportive housing, and the services that go with that housing, we combined the 2 of those. So it's now 1 section. The section 3, which talked about bed availability, we keep that intact. There's just some amended language in that 1 pager for that section 3, which is bed availability. And then section 4, which Justice Mills just spoke about, remains intact. The other thing that's really important to note is throughout the document, we've cleaned it up a little, so there's no reference any longer to secure facilities. It's been replaced with least restrictive. So that's the bill more succinctly. And what Justice Mills is talking about is that on section 4, just to keep that stream of consciousness, The court order currently exists. There's just no time frame on it. And that section of this bill, Justice Mills and the Languishing Committee is saying put a time frame on it of 30 days. That 30-day time frame is critically important so that we can save Representative Jabna those 5 to 6, 6 to 8, and that's just in Cumberland County. We can save them from languishing for months in these jails where it's not appropriate. The other component of this, though, is this bill's not just talking about the forensic beds. We're talking about what Representative Madigan brought up, which is the need for housing that includes those supportive services. And I think Colin Ryan, who's here, can go into deeper detail, but we know from the statistics, we have data that shows if this population is placed within that supportive housing, and you heard Justice Mills talk about treatment, that's what we're talking about, treatment, then they are more than likely not to end up within the criminal justice system. The housing and treatment is the key.
Right. I think that case has been well made, and I also think we have a living example in the work of the Fuse legislation,
Exactly.
which is why I invited Mr. Ryan to join us.
And I would say, Senator Claxton, thank you for mentioning that, because if you can understand Fuse, this bill before you essentially implements Fuse. This is the implementation of it. And it identifies those same 200 people. It's the same people we've pulled out in Section 4, those who are languishing in our jails. Thank you, Senator.
And I was thinking of it more of as expansion of the existing Fuse legislation to include some people who might otherwise not be in that top 200 category. Okay. Are there any questions of the sponsor before we go to Mr. Ryan? I don't see any. So, Mr. Ryan, welcome. So the question I was asking earlier of the justice or alluding to was, is what this bill proposes to do pretty equivalent to what's already in place in Fuse? And what will we accomplish by expanding Fuse from 200 to 300 or 400?
Glad you asked that, because there's an easy answer. This is part of Fuse. It is the same population. There's an overlap. And as you know, the same population not only touches jails, but it touches hospitals, touches homelessness, and all of our emergency systems. This is Fuse from the vantage point of jails and the criminal justice system through the courts. It's going to capture that portion of the population that we see particularly ricocheting from that direction, if that makes sense. It is not an additional group of people. It does not add to Fuse. It is diving in and starting to implement Fuse for a portion of the 200 people.
So from what you just said, Fuse is not currently active in the way you just described.
That is correct. What you all just put into law last July allowed for a committee to form, and it did its work between September and the end of December of 2021, which was to figure out how to best implement Fuse. And we pulled together all the expertise necessary to come up with a strategy and gave you a report at the very early part of January on what the recommendations are for Fuse. So that's as far as Fuse has gone, is to basically said, here's what needs to be done. What this bill does is it says, okay, we know what needs to be done. Here's a chance to implement it and get some of it done to solve how this problem shows up for these parts of our emergency systems and our courts.
then maybe as part of the work the committee at Fuse has done is to look at the issue of forensic beds. And if there are 20 people today in our jails who really belong in forensic beds, and we give them 30 days notice, do we have the capacity to meet those needs from the work that the committee has done?
And that's a question I think that we need to solve that. But clearly, if we don't solve it, it's not solved by having people sit on jail floors naked, as Justice Mills described. And I just wanted to differentiate because I think there was a little confusion. Housing is the ultimate answer for the population, I believe. But that will take on lots of different forms. And I don't want it to be confused with residential treatment facilities that are court ordered. That's not what we're really describing as permanent supportive housing by any measure. That is solving the immediate treatment need of an individual with an acute mental illness and crisis, so that they are better situated than in a jail. So
that doesn't rise.
People in housing in 30 days, we might get them. What the goal is to get them into a bed that's appropriate for their needs. That's far better than a jail. But ultimately, I would hope the system would work to get that person into permanent supportive housing where they would ultimately live successfully.
Thank you. Representative Madigan?
Thank you, Mr. Chair. Thank you for being here today, Mr. Ryan. I guess my question is, are some of the folks that are part of this Fuse group, this 200, give or take number of people, are some of those people consent decree members?
Very likely, yes. Actually, yes, indeed, they are. We have recognized them on our by name list and marked we've created a column for people that are known to be in that category. But not all, yes.
Sure, but anyone who enters into Riverview, previously AmHigh, becomes a consent decree member by virtue of that admission. Thank you.
Thank you.
So one of the concerns we've heard in conversations was how to get these beds that are needed built out into differing parts of the state. Was that something that the Fuse committee spent any time considering?
It did, but it also recognized that there's a way to do this. We've tried doing nothing, that doesn't work. And we know that we've got about 200 people, but we also know that 90% of them are well known to us already and likely to be concentrated in Portland, being such a major service center community, and Bangor being another major service center community. And what we decided as a committee was to start there and grab sort of the low-hanging fruit, get systems working to solve the issues in those two service center communities, and then take our learnings from there and apply them to the remaining individuals, maybe some 10% that are elsewhere in the state. And this bill contemplates the need for service housing, and the amendment also speaks to this, but it contemplates the need for housing and service center communities, as well as in broader geographic regions of the state. And we need both.
I'm sorry if it was part of your report, but was there a attached fiscal estimate to what it would take to address this 200 in terms of short-term expense?
There was not in the Fuse report, but I do believe it's quite possible to do an analysis of what it costs. We know what typical permanent supportive housing costs, and we know what the other systems are involved, and we can multiply that by 200. The variables here are that there are a variety of different housing models, and there are going to be a variety of different needs for each of the individuals. So we should be able to do a fairly accurate fiscal estimate of what's needed. And it is going to be a combination of housing and services. And this bill covers those two, but also recognizes that some need immediate access to a bed, a psychiatric bed.
Representative Javner?
Thank you, Senator Claxton. Can we please have the department representatives let in so that we can hear from them what it would mean to put the deadline of 30 days in statute?
I've also seen that Daniel Brennan is here from the Maine Housing Authority, so we'll bring him in too. Who else, if you'd like to put your hand up so I can bring you in? Katie has something to say. Anybody else who wants to contribute to the conversation who is currently an attendee, please put up your hand.
Senator, could you bring Dr. Pollard in?
I can. That started to happen. Okay, and let's hear from them, and then we'll get to the folks who are currently in the room, and then Katie Fulham Harris. I won't forget you. Okay. So, welcome, Daniel Brennan. Good morning. Good afternoon.
Oh, good afternoon. Yes, Senator,
afternoon.
nice to see you and nice to see all of you on the committee.
Can you describe your work with the Fuse Committee, where it bumps up against that, and your plans that would address the requisite 50 to 200 units of permanent housing?
Sure, be happy
part
to.
of this bill.
Yeah, I'd be happy to. It's very consistent with the work that we've been doing for years, and we've enjoyed working with folks on this. The Fuse report, I think it was about 5 weeks ago, actually, that I presented the Fuse report to you. Maine Housing's role was to chair that effort, and we did so last summer and into the early part of the fall, presented our report 5 weeks ago. What we do on the ground, if you will, is we're a bank. We have resources, some provided by you as the legislature and some through the federal government, that we offer out to housing developers to acquire and rehab or sometimes newly construct permanent housing. And in this particular area, it's the supportive housing portion of our work. Maine Housing has had a supportive housing program for a number of years. And what we do is offer money out to developers competitively. They acquire, most times they're acquiring and rehabbing apartment buildings. But what's unique about it is the partnership between the developer and the clientele, and oftentimes a nonprofit's mental health organization that will work with particular clients that are housed in the units that we finance. So what the Fuse project does, and Cullen alluded to the relationship between this particular effort and Fuse, it's all very, very tied together, is it helps refine and fine tune our supportive housing program. So just and the program runs annually. It's a cycle. We have a pot of money that we put together. We go out and competitively solicit proposals. We select proposals. We make awards to developers, and then they go off and complete the project. And at that point, it's very much a construction project. So we are in that cycle now where we have recently, at the end of last year, taken in applications. We're looking at those applications, we'll make awards, and then we look ahead to the next version of the supportive housing program. And that's sort of that's our cycle, and that's what we do. So these efforts here help fine tune our supportive housing efforts.
Can you speak to the number of units you've been able to bring on a semi-annual, on an annual basis, understanding it's an approximation that would fit the description of supportive housing?
Yeah, it has varied over the years depending on the amount of investment that we get. Historically, I'd say 10, 15 years ago, we were doing about $3 million a year, and we would be putting maybe 20, 25 units a year online. That dipped a bit during the recession and the mid 2010s, and we're looking to regain that momentum that we had. So we haven't been doing as much as that in recent years. but we have some momentum built up, and clearly we have the financial resources that have been provided to our agency. So the goals that are outlined in the Fuse report in this legislation are attainable, they're achievable, and realistic.
Thank you for that. Representative Javner, did you want to ask your question? Welcome, Director Pollard. Thank you for being here this morning.
Yes, thank you, Senator Claxton. I'm really wanting to hear from the department what a 30-day deadline would mean if we put that into statute.
All set for me to go ahead. I want to make sure I've been called on.
You've been called on.
Okay.
Thank you for being here. Would
Still
you
don't
care to
have the
introduce yourself?
protocols down, but thank you. Yeah, so thank you for the question. We think there's some additional clarification language that would be necessary for a 30-day window. So for example, there are some components that would be outside of the department's control, such as receiving information from the jails to the receiving facility in a timely manner. So we think that there's some additional clarification that would be needed along with the 30-day deadline, such as, for example, provisions around extraordinary circumstances or for cause delays. I'm happy to say more about that, but there are some specific situations, particularly during COVID, and questions around people refusing testing or such things, and how that impacts placement challenges.
So could you just introduce yourself for those?
Oh,
who are
sorry.
listening?
Yes.
That's okay.
Hi, I'm
That's part of the
Jessica Pollard.
protocol.
Still bad at it. I am Jessica Pollard. I'm the director of the Office of Behavioral Health for Maine Department of Health and Human Services.
So with some language changes that you mentioned, referenced, the department could live with that particular aspect. Is that what I heard?
Well, as I understand it, we are beholden to live with what you choose to do. We are, in some ways, we can certainly appreciate the 30 days as being a reasonable time frame. We just do think there are some caveats necessary in the language, and agree that the need to clarify what's currently really ambiguous or silent in the statute about a time frame is an important step.
And I was asking the could question in terms of capacity, not whether you're capable.
Yes, I think we are starting to see an increase in admissions to the state hospitals as we start to see our way out of COVID. I want to add the really important layer that we have added an additional 12 residential level of forensic beds, which is something I don't think we've gotten a chance to talk much about in this committee, our close supervision unit, which would also be an option for people in need of placement, and something we feel really strongly about as a way that we can reduce some of the bottlenecks around inpatient beds, since not everybody who needs a placement, a close supervision, or a 24/7 observation in the care of custody of the commissioner meets inpatient level of care. And so we want to preserve those inpatient beds to the extent possible.
Okay. Are there other questions of the folks who joined us for this? One of mine was about the time and effort it would require to put into place the supportive housing wraparound services that we've been talking about, and maybe your best guess as to how long that might take.
Is that for me?
Yes, it is. And it's a very admittedly nebulous question. I'm just trying to get a sense of how doable all this is and how quickly, and then ask the questions of cost.
Yeah, I think Cullen's point is an important one, that it depends on the level of care, or it depends on the level of support an individual might need. So I think a helpful development for the committee to be aware of is that we are putting out guidance to address what's been silent in policy around a particular community support service, community rehabilitation services, that is a 24/7 staffing availability that we think really can serve at least a portion of the need for supportive housing services. So that's something that we can do, thankfully, without rulemaking or any other kinds of changes to better allow an existing service to meet a need around supportive housing. And we certainly have heard from some providers that that would be a useful model if those clarifications are issued in guidance. The challenge, as I'm sure everybody is aware, is how quickly can we staff these sorts of programs given the workforce challenges that we're seeing. There has, I'm happy to report, been an uptick in the number of certifications for mental health rehabilitation technicians. If you look at comparisons month by month to prior calendar years, but certainly we're still going to see that issue. And so that's a whole separate conversation we could have about how we're trying to address workforce challenges. But I just need to caveat that's part of the difficulty in answering your question. So policy is there, but workforce may be the bigger issue.
Okay, thank you. Senator Baldacci?
Thank you, Mr. Chairman. One of the questions or concerns I have, I think it's obvious that currently we have sufficient funding. And I also think we have plenty of people who have good intentions and know what direction we should go in. But I'm really concerned about how I don't know, and this is just as a lay person, so that's why I'm kind of posing this, is a concern about the lack of coordination and fragmentation. I mean, you have the judiciary over here that's seeing people right in front of them coming to court or coming from the jail. You got the homeless population that's on the streets. You have people in the community that have already been identified that need services. Then we have the whole issue of the psychiatric beds, because I have long held the opinion that Dorothy Dix, for instance, is being underutilized. So we have plenty of places where we see this issue. And I'm just concerned that I think that we could use our time and money better if we had some sort of coordination among these multiple units that are all affecting or interfacing with this important issue. Because I think if we can help homeless people get housing and services, that would be great. And as somebody who's practiced in the courts for 30 years, I couldn't agree more with Justice Mills's rendition of what's happening in terms of the mentally ill being in jail, which is a shame for us. It's a real scandal for us as a society that we would revert back to something that is almost 18th century. And that's where we are. I think if we could have better coordination of these services, that we could achieve a lot more. Maine State Housing, your department, the judiciary, I mean, Dorothea Dix, Riverview. I mean, there's just and we need to figure out how to better coordinate these services.
So this bill could potentially be a vehicle for that, but that isn't specifically referenced other than implied in the overall intent.
If I might, Senator?
If you would, please.
Thank you. A great observation, Senator Baldacci. Just so the committee is aware, these discussions and these collaborations and these communications are going on. The FUSE effort was a formalized way to bring together what is occurring and needs to occur more among the various groups. There is a very open line of communication on a regular basis with us and the department and mental health providers ongoing, and the homeless system redesign that we have been putting in place and implementing is only going to further that. So to your point, it's an excellent point. You've hit it right on the head, and it is happening. it needs to happen more. It has to get more solidified. But that is a direction that I am attempting to work with others to steer.
Yeah, Mr. Chairman, may I, just for a moment?
Let me just follow up with that, what he just said, and then I'll get back to you, Senator Baldacci. So my question and a chance to think about it, would this bill materially advance that work? And I don't need an answer right now. Senator Baldacci?
No, and I just want to thank Dan, not only for being here, but I know he's worked very hard in the Bangor area in terms of issues. So I just wanted to thank him very much. And I know that he's working as hard as he can. I just want to, my concern is to try to make sure we have better coordination. I think that will help all of us, but I very much appreciate what you're doing, and thank you.
Thank you.
So, Mr. Brennan, did that my question? Are you prepared to offer any thoughts about that?
It's entirely consistent with where we are moving and where we're getting to. So this bill would reinforce that focus.
Okay. Assuming that it comes with an adequate enough fiscal note and gets passed. Right, okay. Are there other questions from the group at this point? I'm trying to reference the Fuse report and what the recommendations were in terms of funding for this. And I can't find a number. I guess that would require a fair amount of work with the department and with the committee. And before we could get to that point, and wouldn't be done until we pass some legislation, likely to come up with that fiscal note. Senator Moore.
And I'm going right down that same path, Senator Claxton, thank you. Colin, you mentioned that there's a number of different models, for these permanent supportive housing. What would the average cost be for, say, one unit, so that we could kind of get an idea of, approximately how much 200 would cost?
Sure, thank you. I would say the average is going to be just around $200,000 per unit.
Per unit, okay. Thank you.
We've been joined by Representative Connor. Would you care to introduce yourself, sir?
Thank you, Mr. Chair. I apologize for the delay today. My name is John Connor, and I represent part of Lewiston.
No need to apologize. We've had people popping in and out all day. So I'm looking for any other questions that people have, and I'm not seeing any. So where I find myself, and I'll speak specifically to my circumstance, is that I totally embrace the Fuse concept and the intent to move this thing forward. It sounds that in some respects that movement is already happening. And now the question becomes, what do we need to do with this legislation to continue that progress? The legislation that we don't really have in front of us, the draft we don't really have in front of us, includes some elements that were mentioned by the justice, but aren't in the one pager, for instance. Do we roll those in and declare 30 days? How do we go about that process? And I see the need. I totally accept that. I'm just a little stuck in terms of what the next step is. So I'm open to thoughts or suggestions. I'm hearing crickets. Yeah, Representative Madigan.
Thank you, Mr. Chair. I think for me, I support this. We've heard about this problem for years. Justice Mills was very eloquent about how her group started in 2017. And this is not a new problem. I understand that this bill and the conversations we have about it touch a number of different systems and issues. But I don't think we can let that get in the way of doing something to stop this problem. I would remind everyone that, as Justice Mills so eloquently said, the consent decree was decided in 1989. That's over 30 years ago, and we are still not there. And every couple years we argue about it, and it always comes down to funding. The fact of the matter is that there are people that are being held in our jail, and it's in our jails, and it's inhumane. It's inhumane. That is not where they belong. They belong in a facility or a program that gets them the care they need. And I commend the folks that have been working on this bill, and I understand that we'll have to amend it, but I think we have to act. There's no excuse not to. Thank you.
Thank you, Representative Madigan. Senator Baldacci?
Well, again, Representative Madigan has said exactly what I've been thinking, and I don't want to repeat it, but I do agree that we would be remiss in not taking this opportunity. I found Justice Mills's testimony particularly compelling and truthful and heartfelt. And I agree, Mr. Chairman. I know that you have concerns about, or some people have concerns just about, you know, because the language needs to be changed. We need to, you know, come up with a better crafted bill. And I think we can work on some of those issues in language review. I understand that that's also not a perfect process, but I think at this point, I would be remiss in not also supporting this legislation.
Thank you. I'm going to hear from Senator Moore next, and then we'll go to Colin Ryan.
Thank you, Senator Claxton. I guess, and I agree with what's been said already, and I know this is really, really important. But I think what we need, and what I think we need to do is, listening to Justice Mills, I agree that we need to do something. You know, especially we just can't have them being left in the jails. I mean, that is very critical. I'm so confused. This bill is all over the place. There's all these different components on it. I would support the Section 4 that the justice was talking about. I think that's going to be very important. What's given me a little bit of indigestion in looking at the most recent proposed amendment is, you know, the permanent supportive housing. I know we need it, but the cost, if you know, even like 50 of them, you know, the 100,000, I mean, it's a lot of money there. And it sounds to me like the Fuse program is slowly but surely working through that. Daniel was talking about that. They're trying to, you know, every year they've got a certain amount of money and they're working towards that. So I'm wondering if, you know, if this bill, we need to modify it and to understand, you know, maybe the report on the availability, you know, that's Section 3, and then the Section 4, maybe that would be, what the amendment would be or how it would remain, at least for now. And for this bill itself, I could support that. And I guess that's where I'm at.
Okay. Colin, did you want to contribute here? Oh, yeah, as soon as I hear you.
Sure, thank you. I just want to say two quick things. One is that this does indeed kickstart Fuse. Fuse is not going to be one thing. It's going to be a pattern of different things coming at the issue from different angles. But it does kickstart an important facet, actually numerous important facets of Fuse. I wanted to clarify that. And then I wanted to clarify the amendment. The amendment really helps to speak to the first part of the bill and the second part of the bill, and combines nearly all of those into one thing. And it clarifies a section of the third part of the bill. The rest of the bill remains intact. And what we would love to do is to get you a clear version of this that's absolutely clean, easy to follow, and has a fiscal note attached. And then the last thing that I would say to Senator Moore is that it's easy to get daunted about the costs of permanent supportive housing, But I do want you to know that the resources that Maine Housing will be using, and please check this with Mr. Brennan, but come through federal resources that come into the state. One of them is the Housing Trust Fund, of which Maine is awarded $3 million. And there are other sources that are not state funds. So we're not spending our state resources to create the bricks and mortar of this housing. There may be some service components, some of which will be billed through Medicaid and have a federal match applied to it. And there may be some need for the department to hire some additional intensive case managers, which will incur a cost. But the entire cost of that housing is largely borne from federal resources and not state resources. And I hope that helps. Thank you.
Mr. Brennan, Daniel, do you want to confirm that or
I-
give us some sense of that?
Yeah, no, Colin explained it very accurately. I have nothing else to add.
So you have, using the numbers that we were given, the 200,000 and the 200 people, you have $40 million that's available for work on supportive housing in the next few years.
Over time. Yeah,
Yeah.
If federal money continues to flow as it has, these the Housing Trust Fund, for example, was just allocated more money than it ever has. So all the signs are proving positive. But to Colin's point, the capital dollars for the acquisition and construction and rehabilitation of the housing comes from federal sources, and I don't think is part of a request of all of you all.
Okay, thank you for that. I'll come back to Colin Ryan before I go to the President Perry. Have you modeled what it would cost in terms of supportive services for an average or a number of different levels of care for this population you're talking about?
Yes, I have. My estimate is between $2,000 and $2,500 a year per person for supportive services. That varies quite a bit because some are going to need a higher level of care. But presuming that one person with a caseload that ranges from 10 to 25 people, you can figure out the cost is to have a person hired and their overhead, and that will range between $80,000 and $100,000 per person. And then you can divide that by their caseload size. And that's how I come up with the $2,000 to $2,500 per year. That's how I come up with an estimate that permanent supportive housing in our most expensive market, which is Portland, is about $15,000 a year, and 13 of that is the rent.
Mm-hmm.
And that's also largely borne by rental subsidies that come from federal resources. The tenant picks up a third of their income, and so we're talking about an intervention that's most costly, but the part that's going to be services is going to be in the neighborhood of a couple $1,000s to $3,000.
So if we use 2,500 and multiplied by 200, that gets us to 500,000.
Right.
Is that in the ballpark that you're talking about?
I think it's in the ballpark for for a average. I think
Average.
we have anomalies.
Yeah, yeah. And so that you could wed to the main housing and have a range of supportive housing types available.
Yes.
For those 200.
That is correct. And that's not the only form of services. There are others, and Dr. Pollard has been working on a low barrier access service for this particular population, and that is going to come with a federal match as well.
Okay. Representative Perry.
Yeah, I don't know how this relates, but my question is when we're talking about the homeless in jails and getting wraparound services, is where do you see the greatest need for this? You're talking about Portland, you're talking about other areas, but I know that there are some real housing needs in some of the more rural areas, as well as the need for mental health and programs to do a wraparound. Otherwise, they end up in the places where the homeless don't want to be because they're not near family or that they have no place else to be. Is there any look at seeing how this would work throughout the state?
Mr. Ryan, did you want to try and take a shot at that?
Absolutely. I think there are indeed a concentration of people in Portland and Bangor and other service center communities simply because people have not had their needs met locally in other areas from where they come. What we find is that many people can be housed in lots of different locations, and a relatively few people insist on remaining in that service center location where they have landed. So we need a concentration of housing that's available in Portland and Bangor, but we'll also welcome it to be placed in other service center communities. What is important for the bricks and mortar housing is that it is in a service center location that's walkable, because this is a population that lacks transportation and needs to be able to access other services. And it's going to require outreach support services, and the people who are going to service them are going to need to be able to get to them. So if they're spread out on various country roads, that's not going to work well. If there are several located in one community, that's going to be most efficient.
Yeah, I just really why I'm looking at this is Calais lost subsidized housing because one of the owners chose not to keep up maintenance. That went away. And I had patients who were working, who had the only way they got to work was by bicycle, who ended up having to go to another area and therefore losing their job as a result of that. Calais may be a very small service center, but there are needs that go along with that. And my concern is that we've got to find a way to meet this throughout the state as a result.
Thank you. And I think we'll have to trust that the folks at Maine Housing will begin to build some of those facilities for the average citizen who doesn't have acute behavioral needs or chronic behavioral needs, a little closer to the source, and maybe the service centers will get underemployed. That's the dream.
I get my pitch in.
I hear you. It's part of your job. Representative Connor.
Thank you, Mr. Chair. I think I was going to answer a question or make a comment about something that was said by Mr. Cullen a little while ago. I agree with Senator Moore. I think that the cost is quite high, and quite frankly, I'm tired of hearing it's federal dollars. Last time I checked, the federal taxes that came out of my paycheck were the highest, not the state of Maine. So ultimately, this is taxpayer money coming back. Granted, it may be spread out over a larger group, but I believe that when we keep saying that it's just federal dollars coming in, it's just federal dollars coming in, eventually those federal dollars are going to be all we have if we just keep taking it from our main workers. So I'm hesitant with that comment, and I agree with Senator Moore that this is a huge, huge cost, and it worries me. And I think we need to look at, if it's certain areas that need this, then let's look to those certain areas to help fund it, and as opposed to everybody else funding it. That's my take on it, sir.
So just so we're talking, I'll get to Dr. Skinner next, but just so we're talking about the same dollars, the 400 million figure was for building the buildings. And I hear from Daniel Brennan that is money that he anticipates being available.
40 million, Mr.
40,
Chairman.
what did I say? 40?
You said
400.
400. You said 400 million.
I'm getting close to the budget. I was getting close to the budget. I just
I mean, 400 million, I would agree with Representative Connor.
Okay, so we're talking about that 40 million of the housing piece is not the same thing as the 500,000 to provide services for the folks we're talking about, the 200. I just want to make sure we're comparing or we're referencing the same same numbers. Did you want to respond to that, Representative Connor? I saw your.
No. I just wanted to say I appreciate that and thank you. It just when I hear that term, it's just federal dollars. It begins to get to me because it is still all taxpayer money ultimately.
Yeah, Dr. Skinner, I'm sorry, you've been very patient. Welcome.
Thank you, Senator Claxton, Representative Meyer, and members of the committee. I'm Henry Skinner. I'm the president-elect of the Maine Association of Psychiatric Physicians. Um, I want to mention, since the price tag is a point of concern and legitimately so, that we do have medical studies that show that the housing first approach saves a tremendous amount of money in the long run. The money that we spend on supported housing is recouped in less use of hospitalization and fewer people in prison. And this has been well studied numerous times. And so I just want to reassure people that the potential savings are not illusory. They're not hope. They're well founded and proven. So I do hope you support this bill. Thank you.
And I think I just read a study somewhere that quantitated that drop in cost, or the fact that of so many people who were housed, none ended up in the jails in the next 6 months or something like that. Can somebody reference that and help me cite it accurately? But it was impressive. But this is not the population that Justice Mills was talking about. But it's a start to get to that point. Well, let me go to Anna. So at this point, Anna, do you feel like you have enough direction, focus to be able to craft a bill from the recent proposed amendment and the reference that section 4 would stay in from the initial notes?
If that's what you want, I mean, I think I can figure that out eventually. So you're talking about the two pieces that were in the bill, I mean, in the amendment that I sent out last night. So that's the supportive housing part, and I think the reporting on residential bed availability, that's like the bed locator thingy, right? And then you're talking about the piece that Justice Mills was talking about. Plus, I don't know whether you need let me rephrase that. I don't know whether you also want to include the language that Dr. Pollard talked about related to that, which is the limited exceptions.
And I'm just, and that's what I wanted to know, if you added all those things together, is that something you can turn into language for a bill?
I mean, I think so, for an amendment, sure. So, I mean, those are the pieces that I'm hearing get talked about.
Right. And I'm not saying they should all be in the bill. That's the committee's call. I just wanted to know about your capacity and your, whether you had enough information to work with. Okay, thank you for that. Any hands up? I keep trying to bring in Katie Fulham Harris, who keeps putting up her hand, but she keeps turning down the invitation. So I'm going to give it one last shot. And if you have something you wanted to contribute to this conversation, Katie, now's the time. No, now she's joining us. The last 4 invitations weren't adequate, Katie?
I apologize. It didn't come up on my screen. So Senator Claxton, Representative Meyer, I've been sitting here. Thank you very much. I just wanted to make a couple of quick comments. The first is this bill, which we strongly support, is part of the conversation that you're having with the Appropriations Committee related to the budget and the budget hearing gaps that you heard about for a lengthy testimony earlier this week. So I think it's important. Senator Baldacci made very good points about tying the pieces together. And in my mind, this is a piece of a larger picture that is absolutely needed, and for which hospitals are bearing some of the brunt as well, particularly as the jails have been closed. More importantly, the individuals themselves are bearing the brunt. We strongly support Section 3 as well. It sounds like that there's no question or controversy related to that section. And Section 4, so there is a provision with Section 4 that I haven't heard you mention today, which is really about ensuring availability of residential beds for individuals who have high levels of behavioral health needs, but are in the least restrictive setting possible. This to us, it relates to the conversation that you had in the last with the last bill today. And it really gets to the whole need to ensure that people who with behavioral health needs have appropriate access to the right levels of care throughout the continuum of services. And that conversation is something that it's very broad, I recognize, but we think that this provision in section 4, which is in the 4-page document, I don't believe it's in the 1-pager, though I haven't seen the 1-pager, but that is a very important part of this whole conversation. It's really about ensuring that the department works with the stakeholders to ensure the provision that these individuals have access to residential treatment and that particularly for people who have high levels of need and are at risk of incarceration. So I appreciate the opportunity to say that. And with that, I will.
Thank you. Mallory Shaughnessy, did you have something that you think might help the committee?
Yes, and thank you, Katie, for that. That's sort of where I was heading. I just wanted to again kind of ground this conversation back into the fact that it is a full system of care, and we're talking about the most extreme needs of that system, but we have to understand everything backs up based on what's happening in the rest of the system. So we have, no spaces at Riverview and Dorothea Dix because to move people from our jails into that are having, a severe crisis and are sitting in our jails. But there are people sitting in Dorothea Dix and Riverview who could be maybe treated in a lesser restrictive environment, but they escalated because that service wasn't there. There are people in inpatient care that escalated because there wasn't services in the community again and again and again, down to the lower levels of just services that are in our community that help sustain people with lesser levels of mental health needs who haven't exacerbated or decompensated into crisis. So again, I just wanted to kind of set the context that, we can never just talk about one piece of this, even though we're talking about those with the most extreme needs, because it is a continuum and they're being bumped because the continuum is not being addressed. So that was I just wanted to make sure it was setting back it, in the context that is a whole system of care.
Thank you for that. So yes, Representative Javner.
Thank you, Senator Claxton. I just want to ask for a corner caucus when the time is right. Thank you.
And I think there's a couple ways to go on this. I personally feel uncomfortable voting on something that is taped together and on sticky notes, is what it feels a bit like me. So that's why I was asking the question of Anna. Before we send her off to draft a bill, my thought was to run through the sections and get a thumbs up or thumbs down from the committee about whether there was adequate support for the elements to be included in what we were asking her to draft. Is that a reasonable next step, or do you need a corner caucus before we do that?
No, I think that's definitely a reasonable next step. And then I believe after that, we would still need to caucus.
Sure.
Thank you.
Yeah, and I don't, and with that in mind, I don't think it sounds like I personally am really reluctant to do any voting today without the bill in front of me and a chance to consider language. So that may obviate the need for a corner caucus, although you're always welcome to do so.
No, that would be very helpful. Thank you.
Okay, and my intent was to get to a vote on this, but today, because we're running out of time, but I think if Anna has the capacity, then I think we ought to give her a chance to do her magic and see if we can get to a place of some better agreement and a common understanding of at least what the bill is. Okay, so with that in mind, and knowing that the one-pager references sections 1 and 2, before we do that, I'm going to kick everybody out of here so I can see the thumbs, because right now they're going to be spread all over the screen. So I appreciate everybody who's contributed to this conversation, and don't take it personally that you're about ready to become an attendee and not a participant, but I need to be able to keep track of the thumbs. Thank you for being here, Director Brennan. Thank you, Mr. Cullen, for your work over time and for your vision. I think I have, there's some other members of the committee I'd like to kick out, but that's not okay. No, not true. So
Can I get kicked out too? Just kidding.
no, Anna, you can't. You're here in perpetuity. It's your penance for something. All right. So to rein this in a minute, to talk about permanent supportive housing as accommodation of the sections 1 and 2. What we're talking about is sections 1 and 2 out of the 4-pager have been combined into the first paragraph on the 1-pager with lots of bullet points. Are people okay with keeping that in the bill? Section 1 and 2, also known as permanent supportive housing. Thumbs up if you're okay with leaving that in the bill.
I
Or if
apologize, Senator Claxton. Is it possible to have that put up? Can somebody share that on the screen so we can
Sure,
see it?
sure.
I can
Thank
do that.
you.
Just give me a second to find it. I have it here. I just need to get the right. Okay. Sorry.
This is the sausage part, people.
Yeah.
But I appreciate your hanging in there. It's been a long morning into the afternoon. We'll take a break when we're done with this step.
Okay.
It's been a long week.
So this is the 1-pager before we go to the 4-pager. Representative Javner, is that okay? Oh, you want me to make it bigger, don't you?
No,
No,
that's
that's
perfect
good.
for me. Thank you.
Okay. I saw you peering at it and I wasn't sure.
So
But you're like
Representative-
me, you're trying to see what's going on.
So Representative Jenner, are you familiar with this page?
Yes, absolutely.
Okay, because I don't want you to comment on something you haven't had a chance to spend some time with. And we got it last night at 10. So
So tell me when you want me to scroll down a little. Because you do
so
need
this
to see
is
the bottom.
this is the first paragraph, and you'll go down a little bit further so it includes the last bullet point.
Yep.
If you can.
Oh, why is it not moving? Hello.
It
Sorry,
probably only
everybody.
moves by page.
Oh no, I'm looking in the wrong place. I see what's happening.
There you
Okay.
go. Okay. So what's north of reporting on residential bed availability is the paragraph that I'm asking about whether folks think it's worth Anna's drafting it into a bill format in something we could revisit. Are there any questions about that paragraph called permanent supportive housing? Does that answer your question about at least that piece, Representative Javner?
Yes, thank you. It's just extremely helpful to have it in front of me so that I can see what we're referencing. Thank you.
Mandatory is another word that comes to mind. So thank you for that. So specific to what we just saw, are people okay? Do people want to keep the permanent supportive housing piece in the work that Anna is to do? I'm not asking if you would vote for or against it. Is it okay about leaving it in for the time being for the drafting purposes of drafting? So if you're comfortable with that, can you put your thumbs up so I can see? I see Representative Javin, your head's nodding. Now I can't
I
hear you.
apologize. I was trying to multitask a bit with my people. So
Okay.
yeah, for drafting purposes, for sure, go ahead and leave that in there.
Okay, thank you. All right, and then the next piece is reporting on residential bed availability. We didn't hear any testimony about that, but can you put that up, Anna?
Oh. Sorry, that was in the bit that I just showed you. I have to bring it up again.
It was at the bottom of the bit you just showed us.
Yeah.
There we go. So it's that's the paragraph that I'm going to ask about next, reporting on residential bed availability. Which is the old section 3 from the 4-pager.
I think the old section 3 included some telehealth stuff. That's why I'm a little confused. I don't see that in here, right? So we'll come back to that part later.
Okay.
Oh, I think Representative Talbot Ross has her hand up.
Oh, yes, Representative Ross.
Yes, thank you. Thank you, Senator Claxton. And Anna, thank you for mentioning that. We have taken that out. It's not there because it's no longer part of the consideration for the bill.
Thank you.
Very good. All right, I think you can put that away. How do people feel? Are people okay with asking Anna to draft this into the bill to be considered? Anybody who's okay with that, can you put a thumb up? Okay. There's enough of the thumbs. All right. Okay, and then the last piece, we have to go to a different document, Anna.
Yep, hang on. Let me just
Page.
give me a second and I shall do that.
Page 3 on to page 4.
Yeah, I'm getting there. Okay. You should be looking at that now. So you can see the section. This is the old section 3, so you don't have to worry about that. So there's a couple of different things here, and Katie just brought up the part that I didn't mention when you were talking about the amendments before. The first part was the part, I think that's right, that Katie was talking about the availability of residential treatment in the least restrictive setting possible. This is the forensic side of it. And then lower down was the part you were talking about with Justice Mills.
Right.
Now my understanding, and well, my understanding is not the right terminology for that. I think you'll see in the memo from Dr. Pollard, she is saying that the ACT team part is not necessary. And then lower down here, this is the 30-day piece that we did talk about. So I think there's 2 or 3 things in here for you to talk about. The first is the piece about the department. This is a hard ask, but this is the part about the appropriate residential settings, forensic side. Then the question of whether you do want that ACT team inserted. What Jessica Pollard's memo says is that the current law is already allowing for ACT teams. I'm not going to weigh in on that. I'm just saying that's what she has indicated. And then there's the 30 days plus any language of exceptions that the department have requested. And just let me know if you want me to take that down so you can see everybody, or you need me to keep it up.
Why don't we take it down and get a sense of the committee again? Or all, or yes, Representative Javner and then Representative Perry.
Yes, thank you, Senator Claxton. I do think it's going to be important for us to make sure we put in the extraordinary circumstances clause that Dr. Pollard spoke of as well for the 30 days. I think that that's more than necessary for the department.
Thank you for that. Representative Perry?
Oh, she just said what I was going to say.
Senator Moore?
My question, Anna, you're referencing a memo from Dr. Pollard. Did we get a copy of that? Or
Molly sent it to you, so it doesn't come in my email.
Okay, let me go look and see.
I can probably, I think I might have that. Hang on. Well, while you continue to look, let me see if I have this too. I don't. I can pull it up for you though, if you'd like, or you can bring her, wait a minute, bring her back in again. Hang on a minute. I know I didn't come up with it on my own, Senator, so it must have come from Molly.
I'm not finding it.
Oh no, wait a minute. No, that's not it either. Hang on. I know it's here. I did not come up with this on my own. I'm sorry. I cannot for the life of me. Oh, wait a minute. Maybe I put it. Hang on a second. I got it. So many emails.
No kidding.
Oh, it's not there either. Okay, I know it's here.
Well, we could invite Dr. Pollard back in.
Or Molly can send it to me again too. That's another possibility.
Yeah, I mean, that's fine. We can just, I'm such a visual person and looking.
Oh, I know why you can't. I know why, Senator. Let me just forward you this email. It's because it was submitted as testimony. That's why you can't find it.
Okay.
So let me just hit it right now, and then I can also bring it up.
Okay. Great, thank you.
Okay, so that's why I can't find it, because I'm looking in the wrong kind of link. All right, hang on a second.
Got it.
And I promise everybody we'll take a late lunch break when we get done with this phase.
Okay, so you have to go down to the bottom of the memo where she talks about part 4. So this is the part on the screen right now about the ACT team, the ACT teams, where she said there's no statutory amendment needed to continue this, as the statute currently allows any program specifically approved by the court. I'm no expert on this, I'm just reading the memo. And then, so the rest you'll need Dr. Pollard to talk about, because I'm also lousy at multitasking. But that's why you can't find it, Senator Moore. It was submitted as testimony. I'm sorry about that.
Got it. No problem.
Okay. So with that better understanding of the department's thoughts, is that section something that people want to have Anna draft? Thumbs up? Okay.
So that's both parts, correct? That's the develop and fully fund staffing for residential, blah, blah, as well as the 30 days. Is that right?
Yes, and that assumes a little bit more work with the department and anybody else who can help with that process.
Oh, believe me, I was going to ask for permission to work with all sorts of people. So I'm looking for a carte blanche on that, please.
Carte blanche you have. The committee would be grateful for your efforts. All right. Any additional comments or questions, concerns? So again, I thank all the folks who contributed on the attendee list. We couldn't have gotten to where we are without that help. We're a lot closer to where we need to get to do this bill a proper review. And I'm grateful for everybody taking their time to do that. I'm grateful to the committee, my colleagues, for hanging in there with a long process. I'm hearing tunes of Long and Winding Road, but I won't sing that for you.
Senator Claxton?
Yes.
If I may, before we break, I'd like to just extend my sincere appreciation to the committee as well, and then to the dozens and dozens of folks who've been working on this for at least the last couple of years. And so I think the divergent opinions have come together, and that's why you see so many pieces of this. But I truly thank you all for your patience and your understanding. I thank the chairs for exhibiting such great willingness to stay open to this bill, and to each and every one of you. Thank you sincerely. To Anna, there are just no words. Special place in heaven for sure. So thank you all very, very much.
So thank you for that, Representative Talbot Ross. At this point then, I would entertain a motion to table consideration of LD 1968 pending additional work.
So moved.
Second.
Yeah, moved by Representative Craven and seconded by Senator Moore. All those in favor of going to lunch, voting them to table. We're good, people. Thank you. How about 1:45? And we have 2 bills to do.
Senator Claxton, if I might, if Representative Connor would like to register his votes for this morning.
Thank you. I will be very brief. LD 372, I believe the motion was ought to pass as amended. I will vote yes.
Correct.
And I believe LD 1574, the motion was ought to pass as amended. I will vote no.
Thank you
I'm
very
sorry.
much.
I'm sorry. I need to know which ought to pass as amended for 372 you're voting for.
Correct.
There was one motion from Representative Lemlin and everybody else on the other one. So one was the 300% of federal poverty level, and one was 200%.
Thank you, Anna. It was with the majority.
Thank you. Sorry to interrupt.
Thank you.
Got to get those things right. So thank you for that. All right. So the motion to table has passed. And so we'll reconvene at 1:45. Okay, so we're back in our work session. We have two bills to consider this afternoon. One is 1869 and the other is 1867. Both of those were tabled, so I'd entertain a motion to take 1869 off the table for discussion.
So moved.
And seconded by Representative Connor. Thank you. All those in favor of taking 1869 off the table for consideration. Thank you very much. All right. So let's see, Anna, do you have anything that you want to contribute to this conversation? All right. So to refresh people's memory, 1869 came to us as a concept draft. And as we sat down to work it, we realized that a piece was missing. So we have subsequently gotten a piece from an attorney with whom Representative Martin was working. So that's what we have to work with. That came in on the 2nd. And I'm not seeing Representative Martin. So Representative Meyer.
Thank you, Mr. Chair. Absent any language or the bill sponsor, I would move LD 1869 ought not to pass.
I'll second the motion.
So motion's been made and seconded. Any comments about that? So I think we'll go to Karen. Didn't want you to settle in too much there and have you collect the vote on the move ought not to pass. For LD 1869, the motion on the floor is ought not to pass.
Yes, thank you, Senator. Representative Zager. Representative Zager is absent. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Craven.
Yes.
Representative Craven, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Javner.
Yes.
Representative Javner, yes. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes.
So that's unanimous of those present with, we're pretty close to fully here, aren't we?
Just Representative Zager absent right now.
Okay. All right. So moving to the next item, which is 1867, it too was tabled. So I need a motion to take it off the table.
So moved.
Second.
Moved and seconded. All those in favor of consideration of 1867 by taking it off the table. Thank you very much. That's unanimous of those present. So now we're talking about the Act to Codify Main Care Rate System Reform. And there have been a few changes along the way here as this is matured as a bill. Anna, did you want to start, or do we want the department to come in and update us?
I think it might just be easier to go to the department. I have a couple of things at the end, but they're not important right now.
Okay, so Molly had her hand up and we'll invite her in. And some other folk.
She may be able to tell us who should come in and
Right.
help us to better understand what sort of agreements have been reached.
Good afternoon, Sam Senef. Do you want to introduce yourself?
I am Sam Seneft, and I am the other analyst with Nonpartisan OPA office.
Thank you. All right. So this bill is now off the table, Molly, and ready for discussion. Do you want to update us? Tell us who we should be hearing from?
Sure. Good afternoon. I'm Molly Bogart, Director of Government Relations for DHHS. And it would be great to have Director Probert in the meeting as well. And while she moves over, I can provide you with a little bit of background over the last 48 hours. So we have held another meeting yesterday evening with the stakeholder group and have had a number of exchanges and conversations with them in the intervening time, both before and after that meeting. I think we are very close to everybody being comfortable, perhaps not thrilled, but comfortable. And Michelle is ready to walk you through some of the final changes that we've made in our draft. And I think another hopefully final change that we are willing to make. And so this will be likely shorter than the walkthrough from yesterday. We've cleaned up the draft. You have it in your inboxes as well. And what is reflected are only changes that have happened since we last walked you through it. And so hopefully that provides a cleaner version for you to review, but still notes what changes have been made. So I will hand it over.
There's a copy that's got red, white, and blue annotations, and a more recent copy that's all black and white.
Black and white with like a little bit of pink.
Oh, that's right. That's right. Little
There you
bit of
go.
pink.
That's the latest.
Okay.
And
Do you want to walk us through the latest, Director Probert, or do you want to start with the one with the multicolors and sort of summarize? Because that's still new to the committee since the last hearing. Am I correct?
It is. I think that I can speak at a high level, but if you would like to understand in greater detail, I can do that too. I would look to the committee's preference.
Why don't we start at the higher level and tell us where you've ended up? And I know it's a number of different people contributing to the conversation.
Yes, absolutely. So good afternoon. My name is Michelle Probert. I am the director for Main Care. And thank you for having me back this afternoon. I will say that I'll refer to the messy and the cleaner drafts. The messier draft, you'll see at the top that we have provided a number of definitions. I'm not going to walk through those right now, but I'll just acknowledge, as I think you saw in some of our discussion a couple of days ago, that a lot of these terms can get confusing, and we wanted to make sure that we were being very clear about what we meant when we use those different terms. And so we've added some definition sections at the beginning of the bill. In our continued conversations with a number of the stakeholders, we made sure, I think I can say that there was comfort with the provisions that the bill makes for ensuring that there is opportunity for conversation throughout the process, from posting a schedule of what we're now calling rate determinations is our new, more precise term. So a schedule of rate determinations, a benchmarking report every 4 years. There's provisions for public participation in both of those before getting to the actual rate determination process, which is a term we're using that is inclusive, both of assessing a service for whether we should be using an alternative payment model, assessing a service for whether there is a Medicare rate that is available that it makes sense to use. If there's not a Medicare rate, is there a rate from another payer? And if there is not an appropriate benchmark rate, then we do, and we build a rate from scratch, essentially using what we define as a rate study. So there is now appropriate I think everyone feels good about the level of public participation that is called for in all pieces of that process. I will point out that based on discussions that we've been having this morning, we are recommending an additional change that is not highlighted for you yet. On the second page, it's section 1C.
Michelle, are you intending to be screen sharing?
Yep.
I didn't know I was able to, actually.
Oh.
I thought that people were, okay, I will. Sorry about that. I wasn't sure of the protocol there. Okay, can I see nodding heads if you see what I see? Yes, great. All right, so now that I know I am allowed to screen share, I'll back up a little bit to show you what I was just talking about. This is the section at the top and I am using the cleaner version. This is the section at the top that references the different definitions, which are new since the last time we talked. You'll see that we are now using the term rate determination because we just felt that it was a bit more precise. And so section 1A here, there's a schedule and you can see that it involves noticing an opportunity for review and comment. Section 1B here is talking about a report every 4 years that looks at how main care rates compare to other payer rates. And there's also public review and comment for that piece of the process. And then section C is about the rate determination process itself. So again, it includes public notice. And this is the process where we look at alternative payment models. We look at whether there is a rate from Medicare or another payer that's appropriate. And if not, then we do a from scratch rate study that basically looks at cost components and builds a rate based on data. So, and that also calls for public participation as part of the process and specifies that that public participation shall be prior to rulemaking. And a new addition is that it also specifies that that there will need to be a meeting with the public, not just a transfer of information. So the piece that I was just about to point out, which we are recommending a change based on what you have in front of you, is this section here. So section 3 is where we say that we shall determine whether there is a Medicare rate that's available for the service and whether it's appropriate. Initially, the department had language that specified that we would establish a consistent percentage of Medicare. Stakeholders indicated that they felt that this should say that it should be 100% of Medicare. We had concerns with that. And the conversation was basically, I think I'm reflecting the stakeholder comments accurately by saying that Mr. Austin in particular said that if it can't be 100%, then we don't think it makes sense to say anything about the benchmark. The department really disagrees with that statement. I will say that as an example, in the recent rate system evaluation that was conducted, we found really broad spread of percent of Medicare that we use as a benchmark. And at the low end, as an example, physical therapy averaged 42% of current year Medicare in terms of what main care pays. 42%, so less than half of the Medicare rates. On the other end of the spectrum, there are services where we pay 100% of Medicare. To say that it doesn't matter, for example, to physical therapy, that they're only getting 42% if they can't get 100%, I don't think is accurate. So we feel strongly that there should be equity and that there should be movement towards a consistent benchmark of Medicare. However, we recognize that there are strong feelings on this topic. And we feel that the other reforms in this bill are very important and we want to see them move forward. And so we are agreeing to strike the pieces that I have highlighted here. This was revised language that was intended to soften our initial statement of establishing a consistent benchmark to say that we wanted to move towards a consistent benchmark. But again, we are recommending reluctantly that we strike this language so that we can move forward ideally with the other components of the bill.
So before you move on, then the whole sentence above that where it says when the department benchmarks a rate to Medicare, it shall, that goes away too?
No, it does not. So this part stays. So we are still saying that it is appropriate to, the it shall will go away. Yes, this part will go away. Sorry, Senator Claxton, but this first sentence will stay. It'll still say that we look to see if a Medicare rate is available and whether it is appropriate, but the next sentence would get struck along with A and B.
Thank you.
Okay. So this all remains the same. This is where we get into saying if there's not a benchmark, then there needs to be a rate study, and here's what the rate study needs to include. Down here, you can see that we, per request, have specified that the opportunity for public comment shall mean that there is actually a meeting that takes place. So we have included that.
That's in the sync on our document too.
And section D, this language has remained consistent throughout. It was changed around from the very first version you saw, but section D is really how we ensure that rates, once established, remain sufficient to keep pace with changes in costs over time, whether we benchmark to Medicare or another payer source, or whether we built the rates through a rate study. So that has not changed. The rulemaking section. So, and just to clarify, because there was some confusion on this last time around, section 1 is about the rate setting system and the rate determination process that we use to get to, this is the recommended rate methodology and rate model. And once that has been determined through that process, then it moves over to get established through rulemaking. So the actual setting of the rate methodology and base amount and the payment model happens in section 1. And then to establish that, it goes to section 2, which is rulemaking. So in here, there was really just some tweaking of language to make sure that it was precise. There weren't really substantive changes in there. No changes to section 3 on funding. No changes to the technical advisory panel. We added in the last draft that you saw, the Main Care Advisory Committee through discussion with stakeholders. The suggestion here is that the Main Care Advisory Committee currently has a subcommittee on rates. We are calling that the rate system subcommittee here, and this puts into statute that that subcommittee shall be a permanent subcommittee for the Main Care Advisory Committee. I will say that the subcommittee currently, and this is true for all subcommittees of the MAC, it doesn't have official members. It is open to members of the MAC as well as to open to members of the public. So anyone who likes to participate is able to participate in subcommittees of the MAC. We feel that is very appropriate for a rate system subcommittee because, using my example of physical therapy, while physical therapists might be really interested in the conversations that have to do with setting physical therapy rates, they might not want to be dedicated to discussing rates for every service throughout the main care system. And so we think it makes sense that participants would be able to engage when it is of interest and then disengage if it is not of interest. This also specifies that the department shall be available to present about the rate system updates at each main care advisory committee meeting, as well as at each rate system subcommittee upon request by the chair. We wanted to leave open the possibility that sometimes there might be a meeting where they don't need to hear about this topic. It might not happen, but it certainly could. It has in the past year. The specifics, examples of what the committee may discuss and the subcommittee remain the same, with the addition of the bullet that calls out that the subcommittee may formulate and present their own recommendations regarding the department's activities as well. And that is it for the changes. Molly, if you think I missed anything substantive, please chime in.
This may be my fault, but can we, oh, I'm sorry if there's feedback there. Can we just go back to the pre-rulemaking piece? Because I know that that's of particular interest to folks, and I want to make sure that everybody is seeing the change and focusing in a little bit on the change that we made there.
This change here?
Exactly. Yep.
Yep. So I'll go through section C6 here in a little bit more detail. So again, this is under section C, which is about the rate determination process, which includes determining whether alternative payment model may be appropriate, looking to see if there's a Medicare benchmark. If not a Medicare benchmark that's appropriate, looking to see if there's an alternative payer benchmark that may be appropriate, and if not, conducting a rate study. So for that entire process, this calls out that the department shall present its rationale and recommendations for the rate methodology, resulting base amount, and payment model for public comment prior to the rulemaking process. And we added as well that we will convene a meeting of interested providers and other members to discuss, and that existing language, we would respond in writing to comments with an explanation as to how and whether feedback was incorporated. So just like there's public comment for the posting of the rate determination schedule, and there's public comment for the benchmarking report that shall be conducted every 4 years, there is also this piece on public comment for the rate determination process itself before it goes into the rulemaking process.
Great. And then did we, at the very end, just want to make sure folks also note what I know Jeff calls ministerial changes and the noticing on those. So can we just
did miss that one. Thank you, Molly.
And actually I have to thank Jenny in the waiting room for pinging me.
It wasn't pink, so I missed it. So section 6 at the very end is also new since you last saw the draft. So this indicates that, so as a reminder, there are rate changes that do not require rulemaking. If you are changing or establishing a methodology, there needs to be rulemaking. But if you are doing the annual cost of living adjustment, or if you are just updating, for example, to a new year of Medicare, there does not need to be rulemaking. For those changes that do not require the rulemaking, this indicates that for cost of living adjustments, we will provide 30 calendar days notice. And for Medicare fee schedule changes or addition of new service codes, there will be 7 calendar day notice. Just to explain why there's a difference between the number of days notice, we do not always, Medicare is not consistent about the amount of notice that they provide. If we were to commit to 30 days notice for the Medicare fee schedule changes, what that would basically mean is there would be a delay in us being able to turn on those updated rates, which would mean more burden on providers as well as on the department to reprocess everything. And we don't think that that would be in anyone's best interest. So we felt that the 7 calendar days was more appropriate for the Medicare fee schedule changes and better aligns with how that process plays out currently.
All right, I think
That good?
that's it. Thank you.
All right. So with that much of a presentation, what kind of questions does the committee have at this point? I'm not seeing any. I do now. So let's start with Representative Perry.
Oh, actually, what I was thinking of doing is making a motion. This seems to have hit all of the areas that was brought up to us last time. It sounds like there've been some good agreements. So I would like to make a motion on to pass as amended.
So there's a motion.
Second.
And a second from Representative Craven. I see Anna's hand up.
I'm sorry, I just want to point out a couple of things so that they don't come as any kind of surprise to you. These are not surprises to the department either. There's just a couple of technical things that need to be added here. First of all, I do just want to remind the department that we don't have parentheses or and/ors, so we'll just fix those for you. But just want to let you know that. But also, in subsection 2, which is the rulemaking section, it will also require the standard language that we put in there that says that rulemaking is routine technical. The department didn't put that in because 3173 already has rulemaking, which is routine technical, but because you're writing new rulemaking language, it needs to be in there. So that would just be at the bottom of that subsection 2, just to say that rulemaking pursuant to this section is routine technical, which is everybody's understanding and everybody's intent. It just needs to be put in there. Another thing is that because there's a new advisory committee, I'm not talking about the MAC, I'm just talking about the new advisory panel, that that also needs a citation in Title V where all the boards and commissions are. And I think it's 12004 I is the minimal advisory board, the advisory boards with minimal authority, and that's where that would belong. So that's a technical cross-reference to that panel in Title V. And I had 2 more things. One was actually a question from Michelle and Molly around the MAC. So my understanding from is that the MAC is currently, I mean, it's required by federal law, and that's been cited in there. It's in the department's rules. Do you need to do rulemaking in order to do the rate system subcommittee? Because I'm thinking that you might.
In order to require that it is a permanent subcommittee,
Right.
we would need to do rulemaking. The MAC, I don't think the current language says anything about specific subcommittees. It just allows for subcommittees.
Right. So that would also require that same rulemaking language, that rulemaking pursuant to this section is routine technical, because that current title, section 1, I'm sorry, where the MAC is, where they have more details of the MAC, is a routine technical rule. So that I think that needs routine technical language at the bottom of that as well. I don't think that should give anybody heartburn, and we'll just make it so that it's the word has lost me, but it's not mandatory, that you may need that you are authorized to make rules that are routine technical. Do you want me to? I'll let Molly go before I finish my next thought.
Go ahead, Molly.
Back to what you mentioned about the standard language at the first part, we had, and I think it's important to providers, but our understanding is that if an underlying rule is major substantive for a section, it will continue to be major substantive. Well, your
Yes.
language won't override that.
No, that's a good point, actually. I think we might need to tweak that a little just to make sure that that does not change any authority in any part of the other state. Thank you for reminding me about that, Molly, because there are, for example, the PNMI rates are major substantive. That's the sort of thing you're talking about, right, Molly? Yes. Yeah, Molly's right. That's a good catch. And the last thing I just wanted to mention, I just want to make sure that I'm right about this. So the panel in, I'm gonna lose my numbers and paragraphs and so on, but I guess it's like subparagraph. I don't know what it is, but it's 2, the panel shall review annual schedules of main care policy sections slated for rate studies. I think that it's no longer subsection 1, paragraph F and G. I think they are now maybe A1 and C5. I think that just hasn't quite caught up with the reorganization. So those are all technical things, although I'm glad I brought it up now that Molly reminded me about the major substantive rules. So those are all technical things I just wanted to make sure that you knew about, so that nobody comes back and goes, nobody told me about that.
We can, Anna, confirm now that, thank you for pointing that out. I know you pointed out last time and I forgot again.
Doesn't matter.
That, we'll want to change rate studies to,
yes.
Anyway, we'll just want to make sure that language is consistent, because I don't think it's perfectly consistent right now, but I think there's agreement on intent.
We can make that consistent too. That's a good point. We need to change the language as well as the paragraph cross references. Yes.
Okay, I don't see any comments from the committee. I do see that Jeff Austin has joined us, and I'll give you a sec to comment if you'd like to, Mr. Austin.
Hi, can you hear me?
We can.
Oh, thank you, members of the committee. Thank you very much to Molly and Michelle and Jennifer and the DHHS team. This has been a long slog. I think we can accept the draft as it is and don't have objection. The only parting note I would say is that this is setting out a process and we think it's going to work, but if one side or the other is wrong about our understanding, once we go through this once or twice in the real world, we'll learn from that. We'll all learn from applying this in reality, and then we'll know for sure whether we have problems or whether or not we actually set it up the way we think we're setting it up. And so with that, I think for most of the providers, but certainly for the hospital association, I think we're prepared to move forward, and we think this is good to have something in statute for the first time on how this should work, at least in theory. And we'll let you know how reality goes later. Thank you.
Thank you, Jeff. All right, any other comments or questions? There's a motion on the floor, ought to pass as amended, made and seconded. Any further discussion? Then I'll turn the vote over to Karen.
Thank you, Senator. Representative Zager. Representative Zager is absent. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Craven.
Yes.
Representative Craven, yes. Representative Connor.
Yes.
Representative Connor, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Jabner.
Yes.
Representative Jabner, yes. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes.
So that's unanimous of those present. So thank you to departments that worked real hard on this. Thank you to the providers who were willing to work with the department and make things better. Good outcome. And
Thank you very much.
The committee likes this, so this is good. So thank you all very much for your efforts, and hopefully this will make things go more smoothly for all in the future. All right, I don't see, there's no minority report, so we can proceed. I'll look to Anna to see if she has anything else on her agenda for the day.
So
Or
we have a
Sam?
couple of things.
We have
Sam
some
has
language review.
Yes, but also before you all leave, we need to talk about the racial impact statements and what sort of have a conversation, a short conversation, hopefully,
Yes.
about how you would like to respond to the Legislative Council about the process. But I'm going to let Sam go first.
Sam, you want to do some language reviews, right?
Yep, and I think they should be fairly quick. So I'm going to go ahead and share my screen. Sorry, 1 second. It's been a little. All right. Apologies. All right. Okay, so you should see a fiscal note for LD 1747.
We do.
And you'll recall this is the act to require screening for cytomegalovirus in certain newborn infants. So there is a general fund impact projected here, and that is because it is anticipated that this will require some staff support within DHHS to support this effort. So little over $100,000 a year.
Any questions about that? Okay.
All right. Got another fiscal note for you here. This is little one. This is an act to increase the availability of assertive community treatment services. This is a minor cost increase from the general fund.
That's good. Okay.
And last but not least, I have an amendment review, and this is the minority report for LD 1582, to enact the Maine Psilocybin Services Act, which will need a new title because it is the focus has changed a bit. So it is now an act to enact the Maine Psychedelic Advisory Board. So if you'll recall, the minority report on this was to create this advisory board, but to focus kind of more broadly on psychedelic medications and to focus on the therapeutic aspect of these or therapeutic potential of these drugs. So this bill establishes the board in statute, establishes the members, and these really track closely the members on the psilocybin council as originally drafted. So it is it really tracks that same language. So that should look familiar. It's also there's this usual boilerplate language that you usually see around terms, vacancies. Meeting frequency here is 4 times a year. Quorum language. So expenses, this does allow for board members to be entitled for compensation for services on the board and for travel and board related expenses. And then the duties. So this is where I really wanted to focus your attention. So the board's duties are to A, develop and maintain a long-term strategic plan for assuring that psychedelic drugs, including but not limited to psilocybin and MDMA, sorry, I actually have to spell out MDMA there, so I'll make that change, will become and remain a safe, affordable, and accessible therapeutic option for all individuals 21 age or older for whom psychoactive drugs are appropriate. Review the scientific literature regarding therapeutic application of psychedelic drugs, including psilocybin. And I am not going to try to pronounce that, but that is the official name for MDMA. Study efforts by other jurisdictions to adapt a legal framework for the use of psychedelic drugs, and monitor and study federal laws, regulations, and policies regarding psychedelic drugs, and determine what steps the state would need to take in order to establish a legal environment for therapeutic use. There's a report
on
date.
that page, Sam? Can you stay on that page? Yeah, can you stay on that page a minute?
Yeah.
In paragraph A, it says the last line is for whom psychoactive drugs may be appropriate.
Do you know what? I see that I actually did that in 2 places, and that I think my my Word did not like the word psychedelic and was trying to make it psychoactive, and I thought I caught them, but I did not. So I will do a word search and replace, make sure that I catch all those.
Thank you.
So there is a report date of February 1st, 2023, with recommended legislation. And I'm going to put in actually some language allowing the committee to report out legislation as well, if that's okay. You can anyway, but I know we usually do write that in specifically, so I will add that.
Thank you.
Any questions? That is what I've got in terms of language reviews.
And that was the minority report, correct?
That was the
Sam?
minority report, correct? Yes.
Gotcha.
And Senator, I know that I think we have the racial impact statement discussion, but we also, I think, wanted to clarify the minority reports for LDs 1523 and 1693. I believe that they are not ought to pass, but I just wanted to clarify that. These were two that we were waiting on votes for, and that we now have all the votes in for. And my understanding was that all the minority reports on both of those were ought not to pass, but just wanted to make sure I wasn't hearing anything different.
So is that assent from folks? Because that was 8 and 5 votes, 8 to 5 on both of those, and 5 would be ought not to pass.
These are the health trust bills.
Yeah, 1523 is the trust standalone, and the 1693 was Representative Talbot Ross's more broad. So are people okay with the minority report that way as ought not to pass? Okay, I see some head nodding, so we'll go with that.
Thank you.
So what were the numbers on that, on the, was it 5 was not to pass, or the no against it? Is that correct?
I think 8 was ought to pass as amended, 5
Okay.
ought not to pass on both of
Gotcha.
them.
I was just updating my sheet here, so good. Thank you.
So what would you like to do about the response to the Legislative Council about, so the chapter 2 that enacts this includes a requirement for a report to Legislative Council. I believe it officially comes from the chairs, but we'd like to have, we need some idea of what you would like to write in it in terms of, you know, what was useful or what would have been different that might have been helpful, or what was helpful, those kinds of questions. We don't know what you want. Sam looks like he wants to get a word in edgewise too.
Go ahead, Sam.
I do have, there's kind of some suggested questions that we've been provided, and I can put those up on the screen if that's
I was just
helpful.
going to ask you to do that,
Guiding
Sam,
questions.
please. Yeah.
By the way, Representative Madigan, I just sent you a message in the chat.
Okay. Computer's not liking today for some reason. So I'm just closing a window here to make it easier to see.
So we can do this free form, or we can use the questions.
I think we're encouraged to use the questions is my
Okay.
impression.
All right.
You should see them here. So these are the questions, A through F here.
So I can't see everybody, but I would invite folks to offer any thoughts they have about 5A in terms of the timing of the impact statement. Yeah, Senator Moore.
Well, I would just make a comment that I think the timing was somewhat poor because we had already had the public hearing on it. We were ready to do the works and we'd already had amendments to go with it. And yet the racial impact statements were based on the original bill. And we know that when we're working through bills, oftentimes, especially in this committee, the changes are quite drastic. So I personally did not feel that they were very helpful in any of our decision making because we were already there to that point.
Okay.
I would second most of that observation. It was distracting in some ways. Yes, Representative Meyer.
Thank you, Mr. Chair. I would agree, particularly when you look at D, whether information provided in the racial impact statement influenced the development by the committee of amendments to the bill. Yeah, so timing wise, it didn't, we need to, if this pilot is to be expanded, we need to look at exactly when that information is delivered so that it could potentially shape amendments to the bill, which I think was part of the reason why this pilot was put in place in the first place. Secondly, I would say that we heard from all three, or it was two individuals providing 3 racial impact statements, that there was a dearth of information available to them just out, in their search for information to inform these statements. So I would like to have a little bit more information on what sort of information they felt they needed. And there were some national data offered to us, and I'm not sure how helpful that national data would be when we are looking at legislation impacting Maine. If that's the only data that we are given.
Yes, Senator Moore.
I was just going to add to that also is the fact that several times they said they didn't have sufficient time to really dig deep and to get the data information that they would be able to provide us. They can say in view of time, this is what we presented. So it sounded like they were a little rushed with the deadlines they were given to provide us the racial statements.
And I think that may be addressed a bit by better defining the scope of the impact statement. I mean, I appreciated the work they did and all the research, but I didn't really need to be referenced to the sources. I need to know what data wasn't available that would have helped and how that might be gotten to improve future statements. But I didn't need the more typical academic presentation of these are the limitations of the study. So we may need to be a little bit more clear about what we're asking these things to do. Yeah, Senator Baldacci?
Yeah, obviously I agree with the comments that have been made, but my question is is there a professional staff doing these racial impact statements? I mean, who is developing the impact statements? Is it volunteers on the permanent commission or?
No.
I think it was a contract, right?
Yes.
Is it?
Yeah. It was a contract with the
USM.
universities.
With the university? Okay.
Which is why we got the academic version.
I think the legislative council was in charge of doing that.
Oh, okay. Well, I think that, in terms of the comments, I think that having a system where, because it's a situation that changes and we're not going to be influenced too much if we handle like a fiscal impact statement, unless people want to do that, which comes at the end of the process. So we're going to have to, I guess we need to figure out how they can be part of this process because it's a dynamic process. But I agree with the comments that have been made. I think we need to refine it a little bit better so it is more of a tool. Thank you.
And yes, so has everybody had a chance to look at that list and make any comments they wanted to? Does anybody want to give voice to the concern? Yes, Representative Craven.
I just wanted to agree as well. I didn't find the comments to be very useful, and like everybody's mentioned that they came a bit late. But especially for a policy committee like this, I think that a more robust racial comments would be very useful for our deliberations. So.
Thank you. So I think you want to take that down, Sam, and I want to make sure people feel invited to comment on the value overall of the idea of racial impact statements. And if you don't want to do that now, that's fine. And I'd ask that you submit comments to me so we can include them in our letter. But I understand that there might be questions about the ultimate value of the whole process. I want to respect that and invite some feedback. Senator Baldacci.
Yeah, thank you for indulging me, Mr. Chairman. I just want to add that I think that I think that the best way maybe to handle this process and to get some valuable feedback from them would be to have the racial impact statements provided to us on the original bill by the time there's a public hearing. So that way we have the bill. I understand there'll be amendments going on, but at the public hearing, there's usually the original bill. So at the time of the public hearing, we should have their impact statement so that at that time, while we're considering other testimony, we also have that racial impact statement. And then we'll be better able to, figure out where to go forward with. I think, because I don't expect them to keep, be like an OPLA analyst to be here and give us every detail as we go along. But I think at least maybe at the time of by the time of the public hearing, we should have that. It should be part of the discussion that we see at the public hearing. And I think that's my 2 cents. Thank you.
Thank you. Representative Connor.
Thank you, Mr. Chair. I just want to respond to Senator Baldacci's, and I was thinking the same thing. Should we not get this at the very beginning when the bill is presented to us? Either if they don't want to do it in the public hearing format, at least get it out to us in written format so that we can see it in light of the actual bill. So I agree with Senator Baldacci on that one.
Representative Meyer.
Thank you, Mr. Chair. I would also agree with Senator Baldacci that timing wise, if the intent is to allow this committee to understand if there may be a racial impact based on the language of a bill that we are considering, then it needs to be delivered to us at that time, at the time of the public hearing, or perhaps shortly thereafter, but certainly for the benefit of both the bill's sponsor and for us going into a work session to know exactly what kind of an impact this bill before us may potentially have.
Thank you. Representative Jevner.
Thank you, Senator Claxton. I concur with everybody's comments. I just have one piece that I'm super curious about in the pilot project. I haven't seen, maybe I missed it. Is there going to be some feedback? I'm sure there is. I'm assuming there is feedback from the researchers themselves. I could sense even from them, on some certain levels, some frustrations, some real concerns that they had even of the process. And I'm wondering so for one, I'm assuming the answer to that question is yes. And then 2, how are we going to be able to see their responses to the whole process?
Seems to me we could put that in our letter asking for some feedback because there's 2 other bills that had racial impact statements associated with them, I think. I think it was a total of 5, right, Sam? Yeah, we'd like some feedback about what everybody else said and what Ledge Council wants to do with what they've gotten for feedback. Yes, I think that's quite reasonable to ask.
Could you just ask the Legislative Council to do that rather than have them come back to you with that? That would be my suggestion, is that the Legislative Council reaches out to the researchers that did
Oh,
the
sure. Yeah,
racial
no,
impact.
that's fine, man. No, we don't want to do any reaching. We want them. They're the ones with the contract. Yes, Sam.
I just wanted to note that there is, in December, the Legislative Council will, compile everything and make a decision as to whether to recommend that these continue. So they are collecting that feedback from the other committees that are also going through this pilot process.
Okay. Representative Javner?
I'm sorry, I just want to verify, Sam, did you say December?
My guess is Ledge Council's feeling a little bit busy between now and the end of April. But I agree with you, Representative Javner. Why would you wait until then to process this information?
Perhaps because it's a new, it would be a new Legislative Council for the next legislature. That would be why.
Well, I think
You might have different leadership that has a different idea about what to do with the pilot next year.
My point is, it was this council that commissioned the study and the pilot. They're the ones who ought to give their impression about the value to whatever the next legislative council looks like.
We can pass that on too.
And I think that's actually the intent. I think that is the intent, and I can clarify that, Senator.
Okay. We'll tell them what they ought to do. We've never been shy in this committee, so. Any other items to come before this committee? Again, it's been a distinct pleasure, wonderful opportunity to work with you all. Today was an example of what we can do, and I very much appreciate your hanging in there. Representative Stover.
Yes, thank you, Mr. Chair. I need to register my vote on LD 1574 because I had a meeting I had to go off to.
Well, okay. Are you ready, Karen?
Let me grab that. Yes, I am. It's right here.
Karen, I vote yes on the ought not to pass. I mean, the ought to pass as amended. I'm so
Okay,
sorry.
ought to pass as amended on LD 1574. Representative Stover votes yes.
Yes, thank you. It's
Thank
been
you.
a very, I just want to say Monday was a long week and the rest of these days were also additional long weeks. So it's been a great month this week. I've enjoyed you all. I hope the weekends is long.
That'd be great.
It'll go by far too fast.
It's okay. We're still in the first week of March, even though it was a month long.
Okay, I think that concludes the business in front of the committee. At this point, we have some time to look forward to a 10 o'clock hearing on Monday, wherein we will work a bunch of bills, a whole herd of bills, and I will introduce a new bill that we just got, a governor's bill, and it will be short and sweet, I promise.
Mr. Chairman, I just want to let you know that I've got SLG, so I'm gonna on Monday, so I'm gonna bounce back and forth, but
okay.
I look forward to hearing all about the short and sweet bill, because that will be a first for me. Thank you.
Thank you for the heads up. Anything else? Okay, folks, have a good weekend.